So we need to call this meeting to order. I'd like to welcome everybody. This is a continuation meeting. Primary purpose is the budget. Gentlemen, is there anything that we need to add to the agenda tonight? I know a couple of things. I'm going to add, if it's okay with everybody, we'll add Robbie. We need you to talk a little bit about, we discussed the cameras for your vehicles, and we'll do that. We've got Jim Ruttner here, we've invited to the health department. Also, I guess it was our last regular meeting.
It's coming at 6:30.
Our last regular meeting, you'll recall that I had brought up the idea about the looking into upgrades for our recreation department. And if you remember back during the campaign, Mr. Cuspers and I both sort of said we would commit to do that. We're going to do something sort of unique. We're going to follow through and do it. So we've asked Seth, or we've asked Bobby, asked you last meeting to gather some information on behalf of our board, and he's done that, and he has Seth coming to give us some preliminary information. So it'll be okay. If we add that to the agenda,
We're a little outside the budget. That's why we're bringing this up. Because that part may not be, maybe separate from that, but
yeah,
just want to make sure everybody knows.
So it's okay if we add
Robbie's got
those
one, so
absolutely.
I told him we'd try to give you one first thing.
We'll do that first thing. So,
and in case, just so everybody knows, 5 minutes of closed session when we're done at the end.
Just Chester fill out
for the purpose of
no, he's back.
potential property acquisition.
Sitting in all these budget work sessions unless you really need him. He's available if we do need him, but he's back.
I'll recognize Mr. Beal. Give us a little background about what we're talking about, and then we'll have Robbie come.
Well, as you know, gentlemen, in the sheriff's budget, we're trying to catch back up on the schedule of the cars. And we have approved 6 cars in, I think we will approve, not approve, it's tentative on approval, we'll approve 6 cars for the sheriff's department to get us back, Robbie, to where we thought.
Okay.
We remember 3 years ago, we're trying to catch back up. And at a meeting, Commissioner Haven asked me about how much it was for those cameras. For you fellas that don't know, a local department did donate several cameras, good cameras,
Excellent.
to the sheriff's department. And we appreciate them very much, and we'll leave that department name out because it's not really pertinent for the discussion. But these new cameras, you can basically, and Robbie's going to give you some numbers on those. But if the board sees fit to add this to Robbie's budget, all cars would have cameras in them. So, Sheriff, if you want to speak to that and about how much money we're talking about.
Okay. What we're talking about is the same kind of cameras that we've been buying, and they're $4,076 on each camera for the complete system. The thing about our cameras, we've been getting grants in the past to be able to get those, and I think we've purchased about 10 of them at a cost of only 25% because we were able to get grants. And because of the budget restraints here in the last couple of years, I've not been coming to you and asking for additional grant money because of the way the budget restraints were, and we were trying to save as much as we possibly could. And so what we've done is we've actually, one of the subjects that we talked about with Jack was the possibility of getting a new position for our new building. And with Chief Deputy Major Andy Shields, we went back and looked, and we were actually going to be able to, instead of asking you for those positions, we were actually going to eliminate a position that we currently have with the person that's retiring and take her responsibilities and place it on 3 other individuals that are currently working on her duties. And so at that point, that's when I was contacted by a couple of commissioners about these cameras and the need for them. You recognize that we hadn't been purchasing them, and it's very important for us to get these for a couple of different reasons. Not that I suspect my officers doing anything wrong, but it's two parts to this. One, it protects the officer. It also protects the citizen. Those cameras, the moment an officer makes a stop, as soon as they hit their blue lights, it starts recording both.
What triggers the camera?
As soon as they hit the blue lights,
it comes on.
It automatically comes on. And another thing that's amazing about it, for instance, if you're driving down the road And this has happened several times, where a deer runs out. You don't have your blue lights on, you're responding to a call, you're doing the normal speed limit, something runs out in front of you, totals your vehicle. It automatically, 30 seconds is recording 30 seconds prior to it being turned on. So when that officer immediately turns on his blue lights after that collision, it's already recorded 30 seconds prior to the blue lights being activated. It's the computer system in
How
it.
does that work?
It's the computer system in the cameras. It's amazing. We've had wrecks that have occurred where somebody has hit the officer. It's all on film. Deer running out in front of it. It's all on film. It's been an amazing tool, and it also saves a whole lot of money in lawsuits, where people make accusations against an officer of something they did during a traffic stop, not understanding, not realizing that the whole conversation is being recorded. We go back.
Sheriff, let me interrupt. The sheriff and I and Brian Wells has talked about this last year and this year, and the sheriff can verify that it probably does come down to a he said, she said situation. And just where the camera's been involved with some individuals, didn't we come up with 3 that we knew for sure?
Absolutely.
Does this record audio and video?
Audio and video.
It's
and
digital.
Even if that officer's out of view of the camera.
If that officer is outside, responds to a residence where a domestic's taking place, gets out of his vehicle, walks into the residence, you don't see the officer anymore, but the whole time he's inside talking, it's recorded back to his vehicle. And the officer can't go into his vehicle, doesn't have access or capability of going into his vehicle and erasing that. Not that they would, but they can't. Only the supervisor has access to the box that's in the vehicle to be able to go back and get those recordings.
So Sheriff, what we're talking about is basically for the equipment, $24,500.
Correct.
For all the equipment.
We also have a certified technician that's a deputy that before he came, he was a radio tech, and he's certified in that exact kind of camera.
Other than the vehicle, Sheriff, do you see any more pertinent use as money's tight? But would this, if you're gonna ask for anything else above and beyond, would this be it?
That's
As far as
exactly
equipment
what-
goes
That would be it.
for the citizens of Macon County?
That would be it. I think it's money well spent.
Commissioner Hayden, if you wanted to make some comments about
Yeah,
that.
I did. I wanted to ask you, when you was talking about that box on there, this don't record back in the office.
Depends if we wanted to.
Do you don't want to?
For, when you say that, what are you talking about?
What I'm asking is, as these cameras are running, is it with computers back?
Oh, no,
recording
sir.
in the office? No, it's in the car.
Correct.
The recording device is in the car.
So, sometimes they'll leave the recording going when they're taking the suspect person they've just arrested and they're walking them back into the jail. Especially if they're fighting, they'll leave that recorder going. So when they do walk into the jail or walk into the sheriff's office, it continues to record. That way, because that way they can use that against that individual.
Right. Commissioners, I spoke with the sheriff individually about this before, and I know that money's tight. We're at least involved in a lot of things. But it's something that I discussed with him, and I individually mentioned a little bit to another commissioner, a couple of us about that. I don't know, I kind of feel like this right here is a good investment, not only in the sheriff's department, I feel like it's a good investment in the county, just like Commissioner Field was talking about lawsuits for providing, I mean, they could come up, and we had the cameras in there, and I feel like that, as I say, I think it'd be a good thing to have one of the cars to be out there.
But the sheriff didn't say this, but it's also been discussed, Commissioner Hayden, that yes, it is, it does that, but it certainly makes that officer more accountable.
Oh, absolutely.
It does. It really does. And that's not a bad thing.
No.
We agree.
I'm not saying a bad thing about our sheriff's department here, but I think most of you know pretty much if I've got something to say, I'll say it, I don't care whether you like it or not, and you do too.
Yeah, absolutely.
But I'm gonna say this, I think we've got a good sheriff's department here. I think many a times we see on TV where the news reporters are first to show officers when they do this. And as he said, I think if we keep them more accountable, they know it's there. They know what happens if they do mess up, they know they got it touched up. Anyway, with all of this, I feel like it's a good investment, yeah.
Jack, can we, that we find enough money to move to cover this within our current?
I think so. How many cameras are we talking about?
Talking about, I think we
Six.
said 5 or 6.
Six.
So you said you might get by with 5, that you was undecided, you might get by with 5, so it'd be, if we go with all 6, it'd be 25-5. If we go with just,
Little 20.
yeah, you'll go 20, so I would say, Mr. Chairman, what I'd recommend as liaison is that we would add that to the list for the county manager, and then as we prioritize, we'll certainly take it under advisement.
The only one other thing that I wanted to mention to y'all, and I know I probably don't need to say this, but I would like to. We've worked really hard to stay within our budget, and as a county manager will attest to that, our biggest problem that we have is the same as it's been for several years, is the mental health situation. And that's where our budget's being killed, in our overtime, our part-time. Just this week, we had 2 juveniles that were committed, a 5-year-old and a 6-year-old.
I met the ambulance I met the Macon County ambulance right outside of Burlington.
Yeah. And I just,
We knew about that,
I was in Florida.
The
when that
secretary
took
also
place.
knows about that one.
Good. I was in Florida when all that took place, and
A 5-year-old involuntary commitment.
I'm just very proud of our
New
county
record.
services, our EMS director, our EMS personnel, our deputies, Major Shields,
The hospital.
the hospital. Everybody just worked really good, not to make a traumatic event for this 5-year-old child.
There
Who
are
would not have
10
gotten
beds
services.
in the state. Do you know that, Dan? 10 beds. But when you talk to the secretary, he seems to have
For kids? What are you talking about?
Yeah, for that age kid. Copeland over at Memorial Mission's too young, I won't tell you.
Our involuntary commitments last year, the year before that was 100. Our involuntary commitments last year was 138. So far this year, this time last year, we were at 51 involuntary commitments. As of today, or actually the 1st of May, we're at 85 commitments. So we're looking at
you're
204,
you're 40%.
70%.
70%.
70% increase.
I did speak to the secretary, and we're gonna generate, we got a meeting in the morning at 8:30, and we'll have a new report to generate to him. And we have another meeting, we have a follow-up meeting set up with him for the end of the month, so.
If not for the hospital, we'd be in big time trouble. We're very
Some of these
close.
counties are.
Yeah, we're very lucky the hospital works well with us on involuntary commitments.
Well, we'll keep working, sir, that's all I
Let me
can
ask you, I know we led off just a little bit on those raids. You said that 6 would be enough for all, possibly 5. Explain what that difference is.
One vehicle wouldn't have it. Right now, we've got 5 or 6 vehicles that don't have it, so anything we get is gonna help, in the long run. But I wasn't gonna be choosy. I'm gonna take whatever I can get. 6 would complete what we're asking for.
I appreciate it.
Thanks,
Robbie, we will,
We'll let you
take that under advisement. I
Thank you.
certainly make every effort to make that happen.
Thank you.
We feel like you do that's very important to outfit those cars properly for your officers, so
Thank you.
that'll be a high priority.
Thank you all.
Thanks, sir.
You too, sir.
All right, what were we going to, Mr. Jones? I think we'll go to the health department. And, matter of fact, that's where we got to. That is, if you'll flip over, gentlemen, that would be under your tab. It says general fund expenditures, and we're on page 38. I believe that's page 38. We got that man to go. I believe we got about a half inch to go. Well,
You're getting ready to take about
Three
3/8
quarters
of
of
an
it is
inch.
probably the 29
You're getting ready
pages
to knock
that I
out
have
about
in there.
3/8 of an inch here.
So, Jim, yours, of course, was one of the larger budgets and a little different in some ways. So we just felt like we wanted you to come in and talk to us a little bit about what's in the budget, explain a little bit, not every line item, not detailed, we've all been through it, but.
Have you got the same thing we got, Jim? Starting with health administration, Then you go to
Yeah, should be
operations.
the pay,
same
should be
order.
the same order that you have. I mean,
Okay, great, great.
Are your pages numbered, Jim?
no, my pages aren't numbered.
Our first page is 38.
Look at
My first one is page
Okay.
3.
Number.
Yeah, we've got the whole.
5110. See
It's
that
got
on
it,
the
it's
left?
just not done.
Yeah, yeah. I'm just saying, if we have a question, we say it's on page 39, he's not.
Just
going
tell
to.
Well, we'll
Well,
tell him what it's
it's
under
on the
operations,
first
smart
6
start.
months.
Gotcha.
Look at
Okay.
5110, that's the,
I'm
that's.
telling you,
That's
be
four
extremely
hundred.
flexible, so I think he can handle it.
Yeah. And just to start off with, we recognize how tight the budget year is, and we've struggled when we put this together, and we did put in additional requests for some capital things. And when the manager did his budget, he took those things out, and he and I have had a conversation about that since then. And I presented the budget back to the Board of Health again, and that's kind of who I'm representing here tonight, and in their budget. And there were 3 kind of things that we wanted to talk about from our perspective and answer any questions you have about it. But one was the vehicles being cut from the budget, and another one was our dental clinic and salary parity between the dentists. And
Oh, you, just for clarification, when you say cut, it was in your original budget?
it was in the
And Jack
original,
just
and
got
it was
it.
eliminated in the manager's budget. And we've had some conversation about that, and I've had talked to the
We
board.
just broke one in for you.
And,
And
yeah,
it's
I'm telling
it's
you.
a dandy. And all you gotta do is pinch off this little hose and it'll blow cold air all the way to Raleigh and back. It's got 35,000 miles on it, but it's 14 years old.
I know.
So,
But there's a reason why that one is 14 years old and has 35,000 miles, because it won't go up these cow pasture roads.
well, that's true, but
and
we
we'll
run
talk
the
about
interstate
that.
like a rabbit.
Yeah.
I'm telling you. I'm not-
But so we have kind of 2 things that we want to talk about. But in conversation with the manager, we may have a plan that I'd like to pitch, and as we go through
That's
this,
a good plan.
and the Board of Health actually sent me to the manager with the plan. It was their plan as well as mine. But basically, every year the health department leaves money on the table at the end of the year, that's county money. We don't always hit our revenue targets, but we consistently leave money. We're a little bit different than a lot of other county agencies, and we project our money. And people will go, oh, it's an over projection, and you should be able to eliminate $300,000 from your budget tomorrow. But that's not the reality for us. The reality is we're a healthcare organization. We don't know what's coming through our door any given day. We might see 300 pregnant women this year, and next year we might see 700 pregnant women. We might see 50 people for family planning, and next year we might see 700 people for family planning. Our budget is I don't know what you call a saw.
Moving target.
And they're
And
very much
in
moving
fairness, there's no
target.
way to accurately predict that, and we still have to serve the people that come in.
Yeah,
So,
and there are a few things that we wanted to talk about, and as I said, I've already had a conversation with the manager. One of them is that we provided 3 options to the manager with our capital requests, and the capital requests totaled $122,000, of which we weren't asking for the whole $122,000 in this year's budget. Option 1 was to replace 3 vehicles and replace the carpet in the health center side of the building. And option 2 was just to replace the vehicles and not the carpet, because the carpet could be dropped a priority. And option 3 was not to do any of those and reduce our budget by about $58,000. The county, in the manager's budget, it eliminated those projects, picked option 3 and eliminated another almost $11,000 out of the budget.
Jim,
Or
I
excuse
know
me, eliminated.
I get lost real
Yeah.
quick.
Yeah.
Go back to
I
health
did too.
administration where we're started at,
Yeah.
if you don't care, and then as you come to those things, I got mine sort of late, I can't keep up with these 2/3 and 1/3 and 4 cards. So, let's start with health administration.
Go for it. Health administration,
Explain the cut on the salary.
the cut on the salary was we moved money from administration, that was a nurse position in administration, to health education this year, and hired a nutritionist to work in our diabetes program in health education section. So when you
So
see the
that
health
can't-
education salary,
So where will that be?
Health ed.
Where will the cut money go to?
it goes from health administration to 51,
Just a second.
45, I think is what it is. No, 40, not 45.
46 is health promotion.
Health
It's on
promotion, health
page
education.
51.
So, health promotion education.
So and that was 64,000 last
It
year.
bumped to
187
and was adjusted.
To 187,
to 171.
to 171 this year, because we moved the entire salary
Okay.
with the positions so that it didn't skew administration. So we moved $67,000, I think it is, off the top of my head, to health education. And then when we hired the position, it was hired in at less than what the nurse was paid. So there was,
So how many employees are in health administration?
in health administration,
100%. I mean, what I'm saying is, how many is in health administration?
I can tell you that in a second here.
It comes out of the 124,798.
Myself,
Shirley,
yeah,
20% of capital.
myself, 100%, my administrative assistant, 100%, and Kathy McGaha, the quality assurance person, 20%.
And Lord,
This is the one we give the county, this is the one we give you.
That's a great piece. Yeah, I like that one better. That was easier to read.
Oh, yeah.
And Lori, am I looking at the wrong, is there I know we DSS starts on page 67. Is there these are all separate items. Do we have a total? Is there a,
It's total for health.
is there a
Total
total?
for county money for help?
Yeah,
Yes, we do. Can we get copies of that?
because we don't seem to have that, or I don't seem to have it.
You won't have it here.
Okay.
So we could get some copies made, that'd be wonderful. I appreciate that. I'm telling you, if you look at it, it's a lot easier the way it's laid out.
Which totals for health in salary or totals for health in?
Yeah, I think we're looking
Bottom line, total county allocation.
total county allocation. You got that too.
Yeah, I have to do the math on it though.
Yeah, you got one chart to
That one already showed it.
I'm not
At least you did in the papers.
Yeah, I didn't, well, total allocation for salary or total
Total
allocation
for
for
county
everything?
dollars, which is what I think the question is being asked, right?
That is what
I can interpret.
Yeah.
That's right. We're just trying, I'm trying to get what the
Yeah.
health administration, what the actual cost of those 2 and 1/3 employees are.
$124,000.
120.
I mean, you gotta add all that other stuff with it,
In
Oh, okay.
base salary or in
total.
171,518 is salary.
You know, then you gotta add
Give us a salary.
overtime, you
The
got
hospital.
FICA, hospital.
That's 171,518 is all of those in salary added together in healthcare administration, health administration.
170 what?
580.
171,518,
That's for 2.2
2.2.
2.2.
employees.
Okay. I think we understand.
So far, so good.
All right, Jim, do you want to go through each page of it as we have
It
it?
helped me. We always struggle with this, but
As in,
it's complicated.
how do you want to, I'm asking how you want to proceed with it, because
Well,
last
just each,
year you told me
what
that.
we've done, as we've gone through is each page represents a different, in some
A
cases,
different
a
program.
different department. In your case, it's a different program within the department.
Mhm.
And I think we understand that.
Yeah.
So administration is administration.
Is that all county money?
The administration is almost all county money, if I have the revenue. get the revenue.
But Lori, everything we're seeing here is county money.
Not necessarily.
This is total budget.
This is total budget.
This is total budget.
Okay.
There is a portion of this that is covered by,
If you wanted to compare, basically all of his budget and expenditure that's key right now,
Mhm.
recommended by manager about 4.4 million. So if you wanted to compare that, you'd have to compare that to the revenue side.
Right.
Which is money coming in from other sources and see what your gap is that way.
And keep bringing in some of it. I mean, they'll talk.
Yeah.
yeah, we bring in about 2,243,000. With our projection, here's what I think you're asking for, is what Tammy just handed me. Our budget as submitted to the manager before the reduction is $4.5 million, of which the county share is about 2.2 million, so it's a 49% basically. And our revenue from either state or fees is 2.2 million,
Which makes it the total of 4.5.
which makes it the total.
So the county allocation, your request is 2.2, which is about 50%.
50.
About, it's 49.1 is what we requested,
And last year's request was, or last year's budget was
about the same.
what? Okay. That's
We
what-
actually asked we asked for $122,000 more than what we, in capital, which
That's
really
what he's good-
subtract, that's what I was talking about
Okay.
before. If you subtract the 58 that we were leaving, that we had absorbed ourselves, we were really only asking for about $60,000 and $64,000 in additional county money.
That's exactly what I'm asking.
Yeah,
what
okay.
we were trying to get to before we started going page by page.
Now, the health administration, Jim, as you look down through the department request and what the county manager put down,
Correct.
all those line items are basically, there's very few cuts. I mean, and what is minor. Are there anything on there that gives you heartburn on what the county manager had requested, or what he recommended or what you requested?
Not heartburn, but the question that I asked Commissioner Cuppers and what the Board of Health asked is that there's a change in the equipment, which is, we asked for $38,000 for carpet, we had 2 quotes, we got 30. That was not our top priority of the things, of the capital we were asking for. We would rather take that $30,000 for carpet and not take a cut in a line like autopsies. We projected 28 autopsies this past year. That's the most we've projected ever. We've always consistently projected about 20. To date, on this sheet that I have in front of me, we had spent about 19, or no, I'm sorry, about 18. But to date, today, we've spent over the 20,000 now. We've reached almost 21,000. And we still have another month and a half in a year. We don't know how many people are going to die and how many they're going to ask for autopsies.
Before we go into data overload, let me see if I can make it work. At the end of the day, after the manager's cuts, okay, $58,000 that the health board wanted, and most of it is for capital equipment, cars, carpeting, etc., as well as autopsies, which they have a real need to fund.
I told people won't come.
They won't say much, but the bottom line is they pull that out. Now, what the health board, and I think what Mr. Bruckner is asking us to do is, okay, we'll live with the cuts, but in that capital line, can we move the money around to meet the requirements that where we think the priorities are? In other words, instead of absorbing the full, instead of giving me $30,000 for carpet, for example, I believe he would rather take a portion of that and put it into autopsies. Okay, and so what we're asking, what the health board is asking the manager to do is, if those are the cuts that are being made, can they come back, sorry about that, can they come back to us with another plan that said, I think that's the plan you were alluding to, but we never got to.
Correct.
Can we reorganize that cut such that we can allocate the money in places where we think, we the health board now, I've got my health board hat on, we the health board think the money is better appropriated. Not that we're battling the cuts. We'll get
That's
to
right.
battling the cuts in a minute.
Yeah.
But not that they're battling the cuts. We'll take the cuts. We just like to have a little more control over where they are. Instead of taking my carpet, you can have the carpet, but let me do my autopsy. You see what I'm saying?
Let me ask you a question.
Did that help, Ron?
Yes.
I mean, he's not battling the cuts right now. He's trying to say, given that you've cut $58,000, I'd like to take those cuts and spread them out over some different line items than what were there. Okay.
Well, let me make a statement in the form of a question. Now, I asked Lori this. If in January, they want to do a budget amendment and move some money around within that budget, could they do that?
As long as the funds are available, yes.
That's what, and the answer to that's yes. So to me, when you have, that's why I was asking what I was asking.
Well, you
I think-
can, let me mention one thing about that. We do that line item transfers within budgets in other departments of the county, but you gotta keep one thing in mind. If we run over in one line item, we take it out another line item, and that line item runs over, and we take out another line item, pretty soon we run out of line items. And so,
And that's why I think we'd better do it up front.
what we look at is when a line item comes in, the line item adjustment comes in, which we do in administration finance. First thing that I, as Lord, look at is, if that comes out of supplies, is there gonna be enough money in supplies to get you to June 30? So you gotta keep that in
Well, I
mind
guess
too.
what I'm saying is, it's more accurate to get it as close as you can when you start.
Exactly.
obviously.
And that's what we're
I
trying to
agree
do.
with that.
Get it matched up now, we won't have to
As
do
far as
that.
flexibility, this department, if you would, has a board that helps make those decisions. And Russ did recognize you, but Russ Stevenson's the chairman. I guess you're still the chairman of that board. We appreciate it.
But that board is a slave to what this board decides. In
But
other words, without having to
You
go
just
through the line
recommend-
item change thing, which I agree with Jack 100%, you don't want to get into that game. That is a losing proposition when you start doing that. You'd be better off to be accurate in your entering budget and in your entering plan and use those as emergencies rather than saying, okay, I'm gonna leave the $30,000 in the carpet line, but I know right now today, I'm not gonna use it for carpet.
Right.
That doesn't seem to be the way, that's not the way we would choose to do business.
No, I agree.
At the health.
I agree totally. I guess what
Okay, that's
I'm
what we're
saying
saying.
is if that ability exists down the road, then why wouldn't we be willing to do that now? If they're gonna move money around, it's.
So I think the thing that started that was, we felt uncomfortable with the amount of money we put in there, we projected for autopsies. But like Jim said, it's hard to guess what that is. Some years it may be 3 times what it is in 1 year. What we basically do is kind of look at a trend of what it cost this year, last year, year before, and so forth, and come up with what we think is an average of what we think it might be. There's no guarantee it's going to be that. It could be a lot more than that. And no matter what number you put down in autopsies, if you put $20,000 down there and you have a bunch of autopsies that you have to do required, and it costs you $40,000, he may not be able to take that out of his budget. It may require him to come back and take money out of contingency to cover that over expenditure in that particular line item.
And see, that's one thing, Jim, with a lot of folks in our community don't understand.
Yeah, and
That the health department, the number of autopsies and who pays for it.
That's exactly
And
right.
then-
And I guess the other point would be vehicles, Jack, just to throw vehicles out there. If you're gonna give me 30, I'm not the health director, I'm just one of the guys that sits on the health board and holds his hand up every now and again. But if I'm sitting there and I know that I've got $30,000 in carpeting and no dollars in vehicles, and that's not the priority that either the board or myself had set, I could see myself walking back in and saying, I'd rather have the vehicles than the carpet, however much 30,000 will buy, if in fact, that need is genuine, and, although that one with Erica, that van's a good van. But if that's the case, but if that's 14 years old, 35,000 miles, you put that on eBay, you'll get some money. But anyway,
Is that the one you drove?
yeah,
No, we had no air conditioning.
we had it on the way back.
Oh.
Pinch that hose off, damn, you got it, baby. Anyway, my point is, without being too facetious,
And thanks,
That's
by the way,
what-
for loaning us the vehicles.
Yeah,
Yeah,
you're welcome.
and we really did appreciate it.
anytime you want to borrow it, it sits in our parking lot.
But at the end of the day, we could have the debate as to the need of the vehicles. You can have that debate. I think what Jim is saying is that they'd like to, instead of us making the priority decision, let us make the number decision
Well,
and let them come back to us with a
yeah.
reoriented priority.
I understand that. The thing about the vehicles, and we had several departments who would like to replace vehicles in addition to the health department. And because we are in a tight budget situation, have been for the last 3 years, we're only replacing ones we absolutely have to. And the only vehicles that we recommended for replacement in this year's budget were vehicles tied specifically to public safety, which was ambulances and police vehicles. Outside of those, if they had a vehicle request in any budget, including the health department budget, we zeroed it out. That was the reasoning behind it. It wasn't a competition between department or vehicles. It was basically, that was the mode we went in, and so we tried to be consistent throughout the budget on that.
I think
That's what I wanted you to say.
I think that's fair. I guess
do too.
what
That's what I wanted
let me
to
just
say.
summarize sort of what I was saying. I asked the question to begin with for a reason. I think we have to look at the bottom line. At the end of the day, what we're allocating for your budget and what that translates to in tax rate and all that kind of stuff. That's what we have to do. We have to see that big picture. When it comes down to, when Jack has made those cuts, which I respect, but if this board wants to move some of that money around, that doesn't bother me at all.
No.
I'm not saying that it's just a free-for-all after the budget's there, but if you know you want to move something, I would certainly be open to.
Well, let me just clarify one thing. As the county manager, I'm also by statute the budget director, and we don't just allow departments to move stuff around without going through checks and balances on that. So, and I'm not saying, and they wouldn't do that. They haven't done that in the health department. But we see.
I'm not suggesting they would, but.
Okay. We just don't want. And I think Laura would agree. We don't want to give everybody to go ahead.
And let's make sure that you understood what I said about reorienting priorities. You reorient the priorities, and they have to come back through the normal budget process. And it's not that you just get to reorient the priorities. It's got to come back through you, and it's got to come back to us. We've got to see it. And
I'm saying that, recognizing that.
Yeah.
The buck stops here. I'm fine with that. But if we can, if we can work with these departments in something that in their mind makes more sense, and I understand why you get the vehicles, that
I
you're being
do too.
consistent.
I do too.
You're being consistent, I respect that. But if there's a way we can help them.
Well, we've got carpet out too.
Well, wait till I twist your head in a minute.
Then there may be some other ways to deal with it, and Jim may get into that before he gets through.
I will, and it'll only take you 2 seconds, but, you know, and Jack and I talk all the time about, we have talked a lot about the budget, and autopsy fees is probably the most little contentious one because of, it's one of the first things in the budget where there's a reduction. But at the same time, I'm looking at one thing and Jack is looking at something else. Jack is looking at previous year's spending over the last 3 years to make a determination on a cut. And I'm looking at the fact that there's a $1.5 million addition in the state budget for the medical examiner's office that will, if it doesn't go in, will cause autopsy fees to increase. They did this same thing to us last year. So I'm planning for the fact that that money's not going to be there. And that's why I'm asking for the 28. At the end of the year, if they get that 1.5 million they need to increase the staffing in the medical examiner's office, then I won't need that $8,000. But going into this and planning, that's kind of where my mind is and how I'm preparing for the year. And I can tell you, just a quick, and this is what I was talking about, twisting your brain a little bit. If you look at the last 3 years of the health department budget, and you look at our actual budget request, what we actually spent, what we earned in revenue, and you subtract any increases or reductions in revenue, in 2010, we left about $400,000 of county money at the end of the year unspent. In 2011, we left about $478,000. This year, the year we're in now, we're projecting about $318,000. And that was what the board asked me to go back to Jack with about these cuts was, could we take some of that $318,000 that we're projecting to not spend this year and go ahead and look at the vehicles, because the Board of Health feels that that's a life safety issue, because I'm sending nurses out in a Cavalier, or I'm sending nurses out in that van that you guys like to take to Raleigh, which you can take anytime you want to, because it literally does sit in our parking lot, because you can't take it to the places these guys go. And the 2 4-wheel drive vehicles that I'm sending them out in, both have over 115,000 miles on them. I have a lot of vehicles that are at the 100,000 mile mark.
How
that
many
we've
vehicles
been-
do you have?
I got a stack of that here somewhere that I can tell you.
I bet I can do, if you can.
$21, I think.
You got more than I have, I said 17.
I have 2 Cavaliers in the van that all have mileage in less than 50,000 miles on them, and they're all bought in 1998 or
Take one of the
before.
well inspectors, they doing that, take one of their,
Well, actually, they are. We took the 2 environmental health vehicles from the empty positions, and that's what we gave the nurses that travel up into the sticks in Topton, and where there's no cell phone service, and they're in a vehicle that's got 126,000 miles on it, that breaks down once or twice a month anyway. And so we have lots of problems with these 2 vehicles, or I wouldn't be asking to replace them. And so that's where they are. But basically, what Jack and I, the manager and I talked about, and what the board asked me to do was present to the manager, why don't we look at what we have this year, what's already been appropriated to the health department, what we would leave on the table anyway at the end of the year, as good fiduciary agents as we are, and use some of that money.
When you need a vehicle, why would you even do that?
Because we gave 3 options. Option 1 was vehicles and carpet.
Why would you even put
Option
carpet
2
in there?
was vehicles. Option 3 was none of them. So we presented 3 different
You
options.
wanted both.
Oh.
Yeah. So
I know why it's in there.
But that's why
this is a budget projection.
wanted carpet.
Yeah, you didn't want
But
either
the
or.
priority
Actually,
between those 2
both,
was
all.
clear.
I like them all, but if we
Yeah,
can't
it's
get them
not-
all, we gave options. We gave option 1 was to get them both. Option 2 was to eliminate the carpet, because that's less priority than having the vehicles. And option 3 was not having carpet or vehicles. And the board then said, if that's where we are, let's ask if we can realign the $30,000 that we have, stick with the bottom line that the manager already came up with, don't change that, and look at purchasing those other things out of this year's budget with the money that we wouldn't spend as county dollars, that were already appropriated to the health department.
Jim, these cars that you want to replace, how much it cost each to replace?
Estimation is about somewhere between $25,000 and $28,000 a piece. We need,
One patrol car.
we need 4-wheel drive vehicles. That's why we have 3 vehicles with less than 50,000 miles sitting in our parking lot that were purchased in
Do
1998.
they go through our purchasing department just like the sheriff's department?
Yes, sir.
On
And we
these,
can do
a lot of
all-wheel
stuff-
drive we can do some of them all-wheel drive, some of them we need four-wheel drive. I sent a nurse up the other day up above top in the house, had no power and no toilets in the house. They lived with an outhouse. This is where they're going, these home visiting nurses. Same place the DSS employees are going. And they take their Blazers. And it just doesn't work with a Cavalier or a van that has no ground clearance. Or vehicles that are purchased in 2001 or before that have over 115,000 miles on them. It's not like driving your personal car 115,000 miles by any stretch of the imagination, because so many different people drive these things, and they have different driving habits, and they are worn more than your vehicle would be at 115,000 miles.
I agree with that.
Where would you like me to go?
Right, back to, on health administration, the only other question I got, Jim, is down there where it says, which I just didn't know, this is something new, I looked back in the other budgets and couldn't figure it out, but under maintenance, it's zeroed out, all the other budgets had a little money in that.
Under,
It's the last one up from the bottom, contracted maintenance, is that for computers or?
no, that was a line that we don't even use anymore. It was one that was created a long time ago, and I don't know what they used it for. I mean, I have no idea, but we've had that zeroed out, I think, since I've been here, pretty much. I don't think we've had money
There
in
was a little
that.
money, I looked back and I figured it was for computer repair or something you had on contract.
No.
Okay.
You mean, is that on?
Maybe copier repair, I don't know. It was too long ago for me
Is
to
that
recall that.
5003, is that?
That's
the
right.
number? Yeah, we didn't have anything in 2011.
But if you went back a little bit, there was always money in there, I just wondered if that was something I just don't.
We moved anything that we had that's contracts is under contracted services, and that's what we moved it to. It could have been the telephone system, it could have been anything, but we never understood that one.
Back in 2019, it was used for door alarms and materials and access devices for smoking out. It was right at $2,400.
Yeah, and that's what we moved that to contracted services, where that
Right, it was
is.
a budget.
Yeah.
No original appropriation.
We never could figure out where it was from, why it was there, why that line was
Now,
created.
this money that you say you had saved, and you had a lot of retirees over at the health department, have you replaced all those folks?
Most of those are all prior to this fiscal year.
I mean, but you said last year, you referenced last year's budget, how much you saved?
Yeah, last year's budget.
And how much that was
A portion of that,
contributed to retirees?
actually not much, because they all worked to the end of the year, and we had to pay them their vacation and leave and everything else, and it cost us about
And have you replaced them
$35,000. We either moved the position, realigned it within the organization, or replaced it
at a lower price?
at a lower price. All of them at a lower rate.
So that's part of the savings, issue.
Well, our savings is complicated, because if you look at another item here that was reduced was not gas fuel, it's operating supplies. It reduced by about $4,200. You don't want to use the word cushion, but operating in our administration line is literally contingency dollars. If I have a pertussis outbreak in one of the schools, I can spend $6,000 in 3 days. And one of the things that we've always tried to do is leave that little bit of contingency money in different places within the budget, in administration or communicable disease or wherever it is, so that if we have an incident like that, like kids going around tattooing each other in the school with India ink and a paperclip, which has happened, or kids going around the school sticking each other with a needle, telling them, oh, now you have HIV, we have to pay for those lab tests. Those people don't come walking through our door saying, oh, here's the money. They blame the school blames somebody else. I mean, so it's a blame game, but somebody's got to act now, because we only have a 72-hour window to get that kid on antiviral meds if the parents want to put them on those. And I don't have
If
the
you're an owner
ability.
like an owner of a business, like a landscaping firm, he infected all of his employees.
That's an inside joke.
So, yeah, I'm not going there.
Mr.
but
Tate's been
so-
saying-
his colleagues.
We have a
Jim
little
never
bit,
said-
we have a little bit of contingency money built into our budget in different places for different events or different incidences as they occur during a year, and they do occur. But there are incidences or events that if we had to come to the Board of Health and then to the Board of Commissioners to approve $3,000 or $6,000 at that immediate moment in time, we wouldn't get these kids on the meds or these people.
The
on
manager
meds
has
to
a
be
bill
on
to
it.
do
We know.
that. You can take a phone call, you don't have to be on the fourth board. The manager has a bill to make that decision.
And we have the ability to request moving money around in our budget or spend that out of another line and come back later on. We understand that. But it's money that is good fiduciary agents of the county and the taxpayer that we leave on the table at the end of the year. This year, the contingency was, we got written up during accreditation a year and a half ago for an alarm system issue that we had around certain areas of the building that people could access, that according to HIPAA, they're not supposed to be able to access. That wasn't done when the building was built. We procrastinated a little bit, yes, because we know that accreditation doesn't come around until next year again, but we're at the point where we've got to do something. And we used a portion of that contingency money to pay for those alarms. It's not a significant amount of money by any stretch of the imagination. We've reduced our budget over the past 5 years by probably close to somewhere between $250,000 and $300,000. This year again, if we don't do any of those options this year, we reduced it ourselves by 58, and the manager an additional 11. And as I said, we're willing to take those cuts as long as what's in the budget right now we can realign to the places like autopsy and places we know we're going to suffer if we don't do something, and or have the potential to suffer, and look at purchasing those capital things out of the money that we're going to leave again on the table at the end of the year.
So at the end of the day, in follow up on the chairman's question, I say this a lot of times, so at the end of the day, the administration, you can work with what the county manager has recommended, and you and he can work and change around the monies and just leave the money as is. Is that what you're saying, Gene?
Correct, and
Yeah.
and look at the money that we leave on the table this year, on the current budget year, 12, to look at those vehicles, those life safety issue things, and we haven't even hit on the parity issue with the dentist that we discussed back last fall, here in front of you guys.
And that, you said the money left on the table, you're talking about when all the line items are added up at the end of the budget year, June 30th, that you would be that much money ahead, not necessarily in capital, but.
Not necessarily in capital, but somewhere
But you'd
somewhere
have to-
in this 29-page budget that you've got
Yeah,
in front
it
of
would
you.
have to be.
I mean, I printed, we took a quick look tonight at this current year's budget, at two budgets. We looked at health education and communicable disease. And right now, if we continue spending the way we are in health ed, and paying the salaries the way we're paying, earning the revenues the way we are right now, yes, at the end of the year, we're gonna be short in revenue in health education. But we're gonna underspend that budget by $86,000 after you subtract what we're gonna be short in revenue. In disease control, we did the same thing. We looked at the total dollar amount in disease control. We looked at what we've expended to this point in the year, what we've earned, and in that one, we happen to earn additional revenue because we saw a little bit more of something. And at the end of the year, we're gonna leave $82,000 in county money on the table in that budget. And those are two of the bigger ones, but by the end of the year, if we project appropriately the way we are right now, or spend appropriately the way we are right now, we're gonna leave about $318,000 in county money on the table.
So Jack,
So
That's
you
been
don't give us that
appropriated
money
already.
back. That money does not return to the
It
county.
goes, yes, it goes unspent. And
so it, big
it
picture.
comes back.
Goes back to the general fund.
It goes back to the fund balance, undesignated fund.
That's right.
And we've consistently, every year, done that. It's either through lapsed salary, through, we didn't purchase as much family planning meds, or whatever, that year.
Well, there's some of these things in here though that Jim, I'll just give you an example of that's worth, I don't know how you could put a number on it, but I saw it in here. Hold on, I thought I had it memorized, maybe I should. The breast and cervical cancer. For
Correct.
that amount, for 82,000, that's on page 48. And Jim can tell you, or Tammy can tell you the number of, not only the women who have been diagnosed early, but the savings that would eventually save all the taxpayers. I mean, Medicaid
healthcare
costs,
costs.
or insurance with non-insured. Is that worth every penny? Yes, it is. That is not even, and I think Jim told me last county he had with, or Tammy might have told me it was these are 5 or 6 ladies who've been diagnosed, because the ladies died night out, they've been diagnosed with breast cancer.
It's about 9.
Yeah.
It's around
Just
9.
One of those.
Who
One of those
would have
ladies.
gone without getting a mammogram if they hadn't come to Ladies Night Out.
And just one. I mean, what would, I mean, that's, so is that money in the bank? I have no questions on that part.
Gentlemen, all of you, I think, are like me, and have been through this. I'm not that concerned about going through each line item as a board. We've all done that individually. Cases where there's a big change in budget, I think the next page there, Jim, operations, the 28,000 wasn't there. That's in capital equipment.
That's a vehicle. That's replacing a
That's-
vehicle
okay.
in operations.
So the 38 reduced to 30, the 28, Jack zeroed, and that's what we're talking about. Anything else?
Well, we did have a little bit of money in there in training and conferences. One of the things that we try and, that the board has asked me to do when I came here was to have a succession plan in place for the time that comes when I retire or leave. And one of the things that we do is try and incentivize people to do some classes through either SEC. We paid for a master. We paid for almost the entire master's degree for one employee. We paid for
Is he still there?
yes, sir. Managed our QA program. We paid for one to do some information technology classes related to health information technology. We paid half the bill for her class because it's a 100% gain for our agency. And that person manages all the health information and subpoenas and everything else that come through the organization. And then in this one, what we're looking for is to get somebody to take a biostatistics class and an epidemiology class. That's a member of the EPI team that we think needs to have those classes. So, I mean, we can do without that if we have to, but that's the kind of stuff that we're trying to plan for. But really, that's the only other thing on that page that would be a question. We are converting our billing system on that page. This is operations is all of our medical records, all of our billing, all of our finance, all falls under operations. And we are next year going from what they call ICD-9, International Coding Definitions, to ICD-10. It's a huge switch, and there is going to be some training involved with that. Training that if we don't send somebody to, we're not going to bill right. Guess what happens when we don't bill right? We don't collect money. So I will realign, if we're allowed to realign, that's one of the things that I'm going to give priority to on the operations budget, because we have to do that. If we don't do that, we lose revenue.
Everything else seems to be.
Yeah, the only other place is if you get to the.
You always billing in-house.
We do all of our billing through the computer system in-house. It goes to the state. The state does all of our Medicaid billing, and then our other information goes to a clearinghouse, and the clearinghouse then does our Blue Cross Blue Shield, Medicare, and then all of the private self-pay patients we bill ourselves. We
Who
did
does
that
your
all.
collections?
Same company that does
Same
tax
company we
office.
use on
Yeah, it does.
Ambulance and all that?
Interstate.
Interstate credit collections, and we do the same as those other groups. The only other two places that there were and they were the capital cuts was, I don't have the number in front of me here, but it's the OBCM, which is one of the programs that we were looking for a vehicle for this year. I'm looking for the number here, which was a $28,000 reduction, and then the other one was the CC4C, which is the Child Care Coordination for Children program. For me, it's 5147. I don't know what page that is for
Page
you
52
guys.
is one of those.
And a vehicle was taken out of that. That's one of the vehicles that we'd like, that the Board of Health felt was a life safety issue.
That's line item 569 502. Is that right?
Yes, sir.
51, 54 is the other.
51,
Page 57.
And again, we are sending these nurses out into the middle of nowhere. As a health department in a rural community, we should have nothing but all-wheel drive or four-wheel drive vehicles. And that's why if you look at, what's that, sir?
You ever had a problem?
With getting places? Yes, I pay for folks to take their personal vehicles a lot of the time, which are four-wheel drive or all-wheel drive, because they don't trust the Cavaliers to go up into the sticks and these dirt roads. That's what, when I came, 2 Cavaliers were being driven by environmental health specialists, and I hate to tell you, they were hauling gear like crazy, man, and we replaced them. We bought 2 new trucks and realigned vehicles within the organization to make it so that all of the environmental health specialists were driving something either all-wheel drive or four-wheel drive.
Do you need 21 vehicles?
Pretty much. We did the math, and any vehicle we lose is about $5,700 a year in local travel that I'd have to build into the budget. Easy, $5,700 a year.
In reimbursement.
In what I would have to pay staff for driving their personal vehicles. So in most of our vehicles, if you look at the average age of a vehicle, except for the 2 that we bought in 2008, we did buy one in 2009. All of the rest of them are 2001. We got a couple of 2005s, and I have 1, 2, 3, 4 that were purchased in 1998.
I don't want to be argumentative
Yeah.
about the, do you need 21 vehicles? Jim, you've got one that's 12 years old, 35,000 miles on it. How can you need 21 vehicles? You don't need that one.
I have.
You haven't driven it.
You don't drive it. It sits in the parking lot.
Then you don't need
And I
it.
pay staff to drive their personal vehicle because the
You say
vehicle
that-
is.
You're saying, okay, all right.
Yeah,
so
you know what I'm
fine,
saying?
Okay,
Yeah.
I'm just checking, because
Yeah.
that don't make a lot of sense.
I'm paying nurses to drive their four-wheel drive Jeep Cherokee or their all-wheel drive Subaru out into the
So
city.
what you're saying is, back when those vehicles were purchased, it would have been better to.
It would have been better to buy a four-wheel drive or all-wheel drive vehicle.
Okay.
And
We
it,
can't do anything about it.
What's that?
How many?
I have 3 Cavaliers, an Astro van, and an Impala. And they're all ancient vehicles. All of them are old, and all of them have almost no mileage on them. I mean, very little mileage on some of them. Because you can't drive them when we need to drive. And then I have to pay people to drive out there to do that. I mean, there are places they can go with them when they have to go in town, or sometimes up to Highlands and some of the places they go up there to visit people. We can use them. We use them to, the van is really predominantly for the mobile roller, which is a mobile van, but they only use it when they have to travel to Highlands or further away, because their workplaces, that school they're going to, so they don't use it that much. That's why it's available for Sheriff's Department uses our van on a pretty fairly regular basis, but they're sitting still somewhere doing surveillance and that thing. You probably
So
won't
would
use it
you
anymore.
say that you still get bids then, because they're not missing?
No, well, I can get rid of those 3 vehicles, but I'd have to build local travel into my budget for those 3.
The 2-wheel drives?
The 2-wheel drive. 2-wheel drives don't do us any good. I could take those 2-wheel drives and turn them into garage more,
That's what I'm saying, is if.
because they
you
don't
could
do us any
you could
good.
Do without having that.
I could do without having them. But the ones that I need to replace, which are the 3 that I'm talking about, are vehicles that are used on a regular basis. They all have over 100,000 miles on them. They are 4-wheel drive or all-wheel drive, and that's what I need to replace.
Okay.
I need to talk slower, because I could have swore that's what I just said.
Well, I'm trying to get.
And I appreciate that, Mr. Hayden. I thank you for that, because I could have swore I just said, you don't need that vehicle, and I was told you did need the vehicle, but now you're saying there's 3 you don't need.
There's 3 that we
Do
don't.
we have them
I
or
see
not?
what you're saying. I missed your point a minute ago. I got
Now,
it.
just a minute. Let me clarify this right here. You're needing 2 vehicles replaced, but if there's 3 that you don't need there to start with, so if you subtracted that out of 21, that leaves 18 vehicles.
Correct.
Is that sufficient enough to run your department?
That's what I need on a regular basis. And of those 18 vehicles, 3 of them need to be replaced.
Can't
You're
do
right.
that. Thank you very
I missed
much.
what
I
you're
can't
saying.
do
I see what you're saying. I missed it.
So in other words, what I'm getting at is if we put them 3 on eBay for the county or has, what is that, you sell them, we wouldn't be hurt.
Sell them.
Good luck with the 1998 Cavaliers.
Yeah, they're old cars, but I'm thinking, I don't know how it's on, but they're old cars.
I'm
You
gonna
pick
tell
them
you
hoses
something.
up, they'll
I
fall
use
apart in
bands
your
on
hands.
every day, and I bought ones in 1985 or 86 off the church that didn't have the.
Oh, no, I don't want to get rid of the van. I want to get rid of the 3 Cavaliers. The Cavaliers are the ones that I'll sell those tomorrow.
Condition, we get rid
Yeah,
of that.
the van we're not gonna number.
So what do you do just to
Well,
cover the
Mr. Manager, how do you
surplus?
want to have?
How you want to handle that?
Yeah, I know y'all have talked about how to move forward.
We did actually, just give me, back up to the other capital projects, this was our, we put some money in there. May not be enough to do it next year, but, that building was built at the same time. We were able to get some other money for DSS to replace the carpet on their side of the building, without a lot of county expenditure. Carpet was put in both sides at the same time, so obviously you're going to need carpet on that side too. So if we can work it out, I think it would be.
And we replaced it this past year in code enforcement, environmental health back there.
Out of unused money from this year's budget. Now, as far as the bills go, I'd like to talk to Jim and see, you gotta have absolute one because it's a life safety issue, or two, whatever it is, which ones of those? Let's ask the board to consider that. Let's sit down and see which ones. we gotta have.
That's fair.
And that is fair, I agree with that, and get rid of the ones that you're not using. You know, they're scrap metal, he'll haul hikers. I'll be all for
They don't
that.
mind if they got air conditioning, not.
Well, one of them doesn't and two of them do, so
I believe we have a
you can swap.
We have a way out. Gentlemen, and just to expedite the process, I knew there were a lot of questions on that we've sort of gotten past. If you look at, I'm looking just for example at page 41, school health nurse, and my notes indicate on that particular page there are no changes at all, 0 changes. From,
I mean, school nurses, 5, I think.
3 of those are.
So those pages, we're not going to have a lot of questions on this time, Ron. Are there any pages that any board member has a specific question while we have Mr. Bruckner here?
Your total workforce, Jim, is it like the county, is it dropped as the county employees have dropped overall, or where are you standing now compared to 3 years?
When I came, we were at about 64, I guess, in '07, and now we're down to about 53, I think, or 54.
50.
So
yes, it's parlay with the county almost.
Yeah,
You're down
we've
about-
eliminated about 11 positions. As work goes away, we eliminated 3, 4, maybe 4 environmental health
So
positions.
in numbers, we all understand you reduced your workforce by about 15%.
Pretty much, since 2017.
Which is probably the
That's-
lowest in the state.
That's about how much we reduced the county budget. Do you have any other questions on moving forward on school nurse, Smart Start? I think it was identical. There's no changes in it.
I don't, Mr. Cuppers, what, you said they was on Jenkins or that they was the board had, or Russell could speak to or somebody about the dentist, that they was.
You or me, it doesn't matter.
Yeah,
I think you probably
well,
more
I can-
eloquent than I would be. So
Yeah, when we presented back
Did the board,
last.
was the board upset with that?
The
Russell,
board
was
is
the board
concerned,
upset,
the
or-
board is concerned, Commissioner Bill, that you present, as hard as we work to get the adult nurse, I mean, the adult dentist, I'm sorry, the nurse on the right here. The adult nurse, the adult dentist, we're afraid that we're gonna lose the child dentist over pay issue, and that is the board's concern, I think is the
And
Cliff
we-
Notes version.
Yeah, and we did present that last fall as a parity
And I would
issue
like for
with
them
them,
to- yeah.
and it was a 10% difference. We increased the dentist position, we're recruiting by 10%. We asked at that time to increase the existing dentist by 10%. We didn't get it in the minutes that whether that was approved or not. We had talked about it, Jack and I, a couple of times, and I think that at that time, it was kind of a wait and see. And
My
then come
recollection of
back.
that discussion, and if I've got it wrong, somebody stop me, was let's get one hired, see what the price is, and then we'll look.
And we'll look
That
at
was
it.
what I understood the board's decision to be at that time. Is that a fair reflection of?
Bobby, yeah,
Correct.
the board subcommittee, and when we came to you guys back in the fall, we said, by the way, there's a parity issue. And we don't want the child dental program to run through the same issues that the adult dental ran into if you lose the dentist. And then the other point was that the dental programs generate enough revenue to where it's a neutral. You know, they're generating revenues that are paying for those programs. So
So how much is he making now?
How much is that
We
dentist
have no
make?
way of knowing how much the child is.
What's the contract? I think
We
Jack-
can tell
For
you.
the 10%, how much is 10%?
It goes.
The sheer fact is, if I've got the numbers right, is
Yeah.
that the adult dentist right now still makes less than the child dentist, but not significantly less. Is that a fair statement, Jack? Is that?
$2,000 or $3,000.
Correct.
And the total of that is you make 110 or
And there's
something?
that page back, hang on, we're getting the page back out of the
Let's say it's 110, 120.
After full rate, so 113 without benefits.
what's the whole check? He's at one, the adult dentist we hired at 113, and the entry salary is 103. So it's about $10,000 difference. And that was what the Board of Health was
You
asking.
might not have no
about the
trouble,
parity
but I bet you can find some local dentists that go to work for that.
issue.
None of
Some of these
them.
offices.
None of them apply.
Well, they're struggling.
None of
Local
them
dentists
apply.
are struggling, very struggling.
Whereas
And- and
So a lot of people lost their dental insurance as well.
That's what we put on there. We were asking for 127 for Dr. Chang, and she's at about 117.
Yeah, that's what I was thinking.
And that's what we keep talking about, the parity issue, is that we had discussed it at the time and said that if we can't get the dentist at 103 and it's negotiated at a higher rate, that we would look at the existing dentist's salary and make an appropriate adjustment to the existing current dentist's salary, which was, at that time was the child dentist. And, you know, we can say that we can find a dentist real easy. It's not that easy to find a dentist. And to find one that's a child dentist, that's even more challenging. And to find one that will stay for more than 2 or 3 years in public health is a bigger challenge. And Dr. Chang has been here since 2004, I think, 2004, 2005. And so we're shooting ourselves in the foot. And that's the point the board is trying to make, that if we do that, and I can tell you, there are 2 counties that are recruiting here in the West for dentists. None of the local dentists are applying. But I can tell you, they're hard hitting and they're paying more than we are. So all we're saying, all I told my board was be prepared, because if she takes a job with one of those 2 counties, we'll be looking. And we'll be looking for 6 months. And at this point in the year, we missed the graduates again, so guess what? It won't be again until next May. So if we lose tomorrow, we're looking at between now and May of piecemealing a child dental practice, which will be impossible.
Did you ask her if she's looking for a job?
I can tell you, she asks me on a weekly basis what we're going to do for her.
She's talking to this man right here.
And
Tell her to give
she
him a
asks
job.
her supervisor almost on a daily basis.
This is the man you need to talk to. I mean, just give the county manager a call. Right? What's covered? I mean.
Well, I mean, yeah, but the problem is, that here's the only argument that I'll make. And I'm not catching the meeting by surprise. We've spent a long time in advance, so we've kind of hashed this one out. The argument that the Board of Health would make is that, and if I say this wrong, Jim, then you gotta stop me, but that the revenues produced would more than likely, I mean, there's money in that program to pay that.
Correct.
that
We have
salary.
always,
But that money is now going somewhere else because it's all going into a big revenue pile, okay? And then the revenue pile is being dispersed to take care of other things. I mean, that's the way it works. Does the same thing in DSS. But the simple fact is that program generates enough revenue to pay that difference if that money were held dedicated to that program. Now, that doesn't necessarily win the day, okay? I'm not saying that it does. I'm just saying that that's the argument that the health board sees. They see a program which is self-sufficient. They see a program in which there's enough money to make the increase. I don't know how much increase we're looking at.
$10,000.
$10,000.
Well, actually, it comes out to about almost 13. Because you've
13
got
because of benefits.
fringe.
Okay. So, but if there were indeed enough money tied up in that or being earned by
That
that
dentist
program,
also has the best insurance in the world. None of these 2 counties that they're talking about can come anywhere near the insurance that dentist
I'm
has
not
in
arguing
Macon
that.
County.
I said it wouldn't win the day. I'm just telling you what the
I
argument
know the 2 counties.
is. So I'm just saying that's the
their
argument.
insurance benefits.
That's
Again,
the
this
argument.
year.
But I had this discussion with the county manager, and I also respect his position on it. But I'm just trying to tell you what the health board sees and what their thoughts are.
There's no contract time on that, though, if the changes are made, right?
I don't follow.
In other words, this person right here, there's no, like, say you got
No,
a deal
it's
for
county
5 years
employee, it's
time.
not a contract.
Okay,
And the whole point is that we want to make you aware that we are going to face a challenge if we don't do something. And risk we run. It's a risk we run all the time.
That's what we're trying to advise you of.
This
There is a risk out
individual's got a healthy program, doing a good job for children dentistry, and she's generating good revenue. And we want to keep that program viable and healthy. And if we can avoid upsetting that apple cart with losing that individual and allow that, we feel as a board, let the revenues they're generating cover the increase and keep serving the kids and having a good
How
viable
many kids you
program.
serve, Russ?
What is the total head count?
Is
Individual, not most.
it's about 20% of the kids in the school system. There's about 4,600, so you're looking at about 900,000 kids a year. That's kids, that's not procedures. Each
Yeah,
kid's getting, 15 or 20
That's
dental
just-
procedures done. It's not
That's just little Johnny being kind of.
That's individual,
Yeah.
that's head count.
That's head count,
Come
yeah.
back 6 or 7 times.
Yeah, because the two
Yeah.
dental programs touch a couple thousand Macon County residents a year. Individual, I mean, that's
It's
how
about
many, how much
2,600
service.
combined when you look at both programs of individual people that we touch out of those two programs. And the budget doesn't reflect dental revenue. I can tell you that now, because 2 years ago, we were told not to overproject dental budget revenue anymore, to make it revenue neutral, and that's what we do. So when we presented the budget to the manager, we presented the budget with that additional revenue in there. Then when we reduced our expense by not giving that increase, we go back and we reduce that revenue again. We're gonna earn that money. We earn anywhere between $45,000 and $60,000 in additional revenue in adult and children's dental program every year. That goes to other programs within the health
So
department.
about how much are we asking for the child dental?
$13,000.
$13,000.
So we just need to find 13,000 somewhere else in the budget.
He's saying he's got revenues from all of it.
Take it out of the private drinking well. 13 grand, take it right out of that.
Sell that van.
Sell that van.
No, not the band. We don't know the band, not the band.
The Cavalier.
The Cavaliers.
Sell
I've got
the
3
Cavaliers.
Cavaliers all turned into the garage tomorrow.
I got that van
I
on.
said, you can get that much out of a Cavalier.
You can get that, we knew
That
that.
man and I have a close personal relationship.
So you just need to, so are we down to this board that we're talking about just $13,000 and that's for the child dental?
That's the difference.
And
And then they're gonna negotiate out the other stuff.
what do you think, Ms. Liaison?
I-
I mean, you were there at the arguments.
You know, you've got me in between two really, really good arguments. And I don't wanna cut the legs out from either one. I understand both sides of it. If the $13,000 is available, I'd love to make it available. But I understand the manager's predicament of salaries. I mean, he's got more than one department for which he pays salaries. And so we gotta be very sensitive.
Who else is getting a raise?
I'm not,
Yes.
nobody. I'm not, well, who else is getting a raise?
In the county.
Nobody yet.
Not us.
We're working on a classification pay plan, which we hope to be able to figure out a way to fund that. Hopefully y'all can figure out a way to implement at some point in time, but we're working on that now. Yeah, and I understand the parity issue, and I know how hard it is to find a dentist, and I've been through that, and Jim knows that. And I understand the parity issue, and that's a real concern. There's also have parity issues with other people in other departments that aren't dentists. So that's where it causes me a problem if I say, well, I'm doing this because of a parity issue in this department. Department B over here is gonna say, well, we got parity issues too, why don't you do something for us? They may not be quite as critical as a hard to find dentist, but it's the same argument that they'll use, and so it's a struggle for us to deal with that. I would like to probably have some more conversations with the chairman about this.
I was gonna say, what we do that, you guys talk about that.
It's not a straightforward issue. I mean, it's an issue because it has two very valid sides.
Well, and
That's
the
the
difference,
problem.
quite frankly, the difference is you have a revenue,
That's right.
not that no positions.
It's a
Not
program
revenue producing.
generating revenue, it's not just an
That's the
employee,
difference.
it's not, it's just an experience or years of service or responsibility, it is a program generating revenue.
Yeah.
It's
So here might be the
Russell Sandy
challenge.
can tell you in the mental health field, this is a conversation all the time.
Here might be the
Just to
challenge if I
find these
can,
people that, you know,
if I can speak
It's
for
a real
them,
struggle.
take the county manager's side here just for a second. The challenge might be if that revenue, if we're going to leverage the revenue that is generated by that dentist to justify that raise, then that behooves you guys, us, the health board, to find the $13,000 elsewhere to make that happen. Am I being unfair? I don't think so. You can't use the leverage on one side and not use it on the other. If you're gonna leverage the fact that they generate revenue to justify the raise, then that revenue's there. It's just that we're choosing to spend it on another health program. We may have to look at
But
that
in the-
sort of deal.
But in the budget we presented, we did.
A zero-sum game.
Option three was a $58,000 reduction in our budget, but it
Then
included
it sounds to
that
me like we have a way
salary
forward on
increase.
that 58,000, and we need to make sure that that's part of the conversation.
And, so, I mean, it was done. The thing about dental is that it does go to support other health department functions. So if I lose a dentist, I've got 4 staff in the Motorola that I still gotta pay that are earning no money, plus the staff in the building that money, that additional revenue is going to support for another program.
Providing an even
So now I
greater
lose,
incentive
I don't
to
just lose
find
my
the $13,000.
my employees in the Motorola and the Motorola revenue, but I lose revenue somewhere else, or I lose service somewhere else in the department in addition to that.
Sounds to me like that's one heck of a forcing function to encourage you to find the $13,000.
We did. We
Okay.
did. We did already.
Let me give you an example that you will relate to. I dealt with this on the school board for years. Franklin High School, there are 28 sports. Is that right? Football pays the ticket. So the problem is, do you put more money into football because of that? Is that fair to the kid that plays tennis, who is excellent, who does a great job, who doesn't generate any money? That's the same thing. Loses money. Every sport in Franklin High School loses money except football and basketball. Baseball.
My only difficulty is, you signed an agreement with the state, and this is, I don't want to push a button, that's what I'm trying to do, by any stretch of the imagination, but the chair of the county commission signs an agreement with the state that says money earned in a health department program will be spent within the health department program, which means in reality, we should be sitting on a pot of money for dental, because we should be stocking that away every year. And that's not a button we push.
But it is spent within your department.
But not within the program, it's specific to the program.
Right.
And that's where this becomes challenging in the long run.
Most of that money Medicaid, is that, most of Medicaid?
The majority of the child program is Medicaid or health choice.
Can we leave it that you guys can have that conversation?
Yes, sir.
Have I put you two guys
No, no, we can do that.
Jim, how much?
We can work through about it.
How much is that child dentist bring in?
Children's dental program brings in, it costs us $310,000 to operate. We generate that plus about an additional $45,000 to $60,000. The reason it fluctuates, that difference fluctuates, is we go to half the schools one year and half the schools the next year. So there's a period of time where we're going to the Highland School, which means that it's, numbers go down, the dollar amount goes down, and then there's years where we deal with the kids out of mental health. And so our revenues are like this constantly with children's dental. And then we have, you hate to say it, but there is some competition for those kids right now out there in the community, and it's hurting us. But when the economy goes back up and those private dentists start seeing those insured patients, those Medicaid kids are going to go. We're going to go through the same thing with prenatal care. Any of the services that we provide right now. There are not many people having babies, but I can tell you the Medicaid clients are. And they're not coming to us in the numbers that they used to come to us. We've got mostly self-pay patients. Those Medicaid patients are going to the doctors downtown because they can say, I go to Dr. So-and-so. It's not, they hold up a card and say, I go to the health department. But in 2 or 3 years, they're going to be holding those cards up saying they go to the health department again because those doctors downtown aren't going to see them the same way.
Well,
I just got 2 quick questions, we can move on.
Yeah, we need to.
I want to talk just a minute, Jim, about the free clinic.
Yes, sir.
And I know it's not in, if you can show me where it is in any of your numbers here.
It's not. The only thing in my budget that's reflective of the free clinic is that we are going to be the recipient of the Zonta funds this year from their art and chocolate. And Zonta chose, instead of giving that money, it's $7,500, instead of giving it to the free clinic to provide women's health services for those clients that get seen there, they've given us that money, and we put it in the budget. We put the revenue in one place, we put kind of the expenses in another for this moment in time, because we don't want to skew that budget too much. But basically, that money will go to reimburse the OBGYN provider that we have, that we're contracted with at the health department, to see some of those free clinic women, instead of trying to send them all the way to Mayheck.
Is the free clinic, I know that it's, it's tight, but is it gonna be sustainable in your opinion?
Free clinic is struggling. I've had several conversations with folks on this board and several other groups in the community, and we have people out beating the bushes all the time. The free clinic here in Franklin was started with a grant. The free clinic in Highlands was started with donations generated within the Highlands community. At a point in time, a year and a half ago, probably 60% of the clients being seen in Highlands were from Franklin. So the idea was conceived to try and figure out how to set up a sustainable clinic here in Franklin. But we don't have the same donation pool here as over there. So they've been living off a grant that was a collaborative between the health department and the free clinic in Highlands to establish this clinic. The county graciously gave them all the space for no cost. We give them office space, we give them clinic space every Monday and Wednesday night. We've upgraded our alarm system in the building with money out of that grant for the free clinic. But in the long run, the grant money runs out in a few months. They have a pocket change basically to support the program. We've come up with several different ideas or proposals, and the problem is getting the right people, and I think we've got some right now that have met with me and met with Jane Kimsey and a couple of other folks, Marty Wadowitz from the hospital, to have some conversation about fundraising within the churches and some other groups here in town. Problem is that we foresee that they're only going to probably earn about a third of what we need.
And the total is?
The total is a little over $100,000 to operate the clinic a year. We've had conversation with the hospital a number of times. Or the board of the free clinic, I didn't say we, it's the board of the free clinic has had conversation with the hospital a number of times to see if the hospital can contribute anything. Because every client they see reduces somebody that's going to show up either at the urgent care or the emergency room. Problem is there's so many people showing up at the urgent care and the emergency room that it really hasn't impacted their numbers coming through the door. So it really hasn't impacted it hadn't changed their bottom line as people perceived it might in the initial phase of the free clinic. So it's a challenge to say, and they have it down. They can tell you that we save for every emergency room visit, it's X amount of dollars, and this is how many we've kept that in the emergency. Because they ask every person that comes in, where would you have gone for care if we weren't here? And they tell them the urgent care, the emergency room, I'd go without. And they can tell you how much the cost would be of all of the diabetics that they've seen through that clinic, that we've now seen through our health department diabetes program for free, of what the cost to the community would be if those diabetic patients hadn't been diagnosed and wouldn't have gone to the hospital, and what that disease burden would have been, what the cost, the actual dollar cost to the community would be. They have all that down. Jerry Hermanson is the man when it comes to that stuff. And,
well, I think it's vital to this community that thing stays. But I mean, on this board, I will support the free clinic. I mean, I know it's tax dollar money, but I think you can make the argument that if we do have to put taxpayer dollar monies into that free clinic, that is actually a money saving tool. I think Jim can make that argument. I think if you see the folks who work in this free clinic and the people that send, Jim knows what it does in Highlands and in Franklin. So are you applying for the community fund pool?
We're going to try. No, they didn't apply for the community funding pool. We're trying to. We're probably going to reapply for the same grant that we got, because they told us that the potential is there that we could receive it again. So a lot of people are banking on that. I keep saying we, it's not us, it's not the health department at all, it's the free clinic, and they have a separate board. They are not associated with the county in any way, shape, or form. And you've heard me say.
It's to the health of the
yeah,
Maconians.
It is for the health of the Maconians. And, you know, it's great to have the free clinic from a health department perspective, because if they weren't doing it, we eventually have to do it, and it would be the county, and then it becomes a primary care issue, and then it becomes a deep black hole, and you'd be throwing money into it forever. Significant amounts of money. Trust me, I came from Buncombe County, we had 18,000 active patients come to the health before they actually figured out a plan within the community how to get them out of the health department. So you're talking about $6 million a year there. It wouldn't be that much here, but you're talking about a significant amount of money if it became a health department problem.
My concern is it's going to continue to grow.
It will continue
If it continues
to
to
grow.
grow and then it stops, if it continues to grow like it has shown it's going to, the numbers show that, and then you stop the free clinic, they're going to come to the health department.
They won't come to us because we don't provide the care. That's the key. We don't
Well, they'll end
see
up
sick
at the
visits.
ER.
They'll end up at
Somebody's
the ED,
Well,
which is
somebody's
gonna cost
gonna
even
call
more.
somebody.
Which is
Yeah.
Hill Burton.
Yeah.
Mhm. Exactly.
So, I mean, I just ask that you keep this board apprised on what the situation is.
And we will. We will.
Gentlemen, I don't want to cut it short, we need to still talk, we have spent over an hour.
Well, we're gonna talk about private drinking wells in 5 minutes.
Okay, that'd be fine.
Are we
Keep
getting
it
numbers
expedited
on
here
the
so
drinking
that-
wells now, Mr. Liaison?
Numbers, what do you mean? You want to,
I mean, it's been drilled,
Numbers that we're doing, I don't have those.
we're gonna have you get the numbers on the septic tanks on the wells.
I didn't know we got them,
Yeah, we used to.
we used to send them. We used to send them all the time. We can do that again. We kind of just,
I mean, it's easy.
they're doing more now than they were a year ago. I mean, it's slowly
but I can
creeping
tell you
back
from
up.
talking to my well drillers, it's picking up a little.
Yeah.
Not much,
Not
but it's
much.
picking up a little.
Of course, you know that with Mr. Davis has started this board, that the organic compound thing is dead. It's done, it's gone, so we don't have to worry about that.
It's virtually gone. They still, what they're doing, and I've had conversations with Senator Davis on it myself, but what they did is they created a bill. What public health was asking for is to allow public health to make the decision of what wells need to be tested for volatile organic chemicals or not.
That's what he said.
The legislative bill said, the original bill said that the state was going to determine that for us. The way the bill is written now is that they're going to put it to the Public Health Commission to make that decision. And I can tell you that the Public Health Commission is not going to make a decision on it. They're going to let it die. And it's a way for the legislature to save face, and it's a way for the public health to save face.
But maybe he said he was
He was sure pretty strong.
It is dead. It's virtually
He didn't
dead.
give it any possibility of
It's
resurrection.
just like anything else. If you get a group of people that get on that public
And I
health
think the next
commission that
thing
want
we
to
look
read
at
it,
is
direct
when
it,
he
they can
talks to
do it.
some folks or, I forget the department, but it's the same people we talked to when we had to over on Georgia Road. He's got to know those people well that I introduced him to. And, so now it goes back to the self-certification thing. And, so now that's the next thing coming down.
Self-certification.
On the way,
Grout.
the grout.
Driving
on the way.
inspections. And that's coming, that's according to what we found out in Raleigh,
Right.
that's coming back around the long session.
That's coming back around, so.
So that's here.
Of course, Jim's written draft legislation in support for
Oh,
self-certification.
we've
Yeah.
been
Oh,
around
we've
the rabbit
been
hole.
we've
We've
always
just
had
never,
Well, we've been on that subcommittee too, championing that.
we've gone around the rabbit hole on it, but it's theoretically it's alive. Now, of course, the interesting thing about saying this is
What we can't understand is how some of these counties are making money on it. We can't understand how they're doing it.
Making money on,
On the drinking well inspection.
they are. Their fees must be astronomical.
But everybody-
I'd like to see a
Well,
county
we
that's
gotta
making money
understand-
on
But
it.
their fee, it may cost them $400 for a permit.
So we don't know.
I don't know that.
Probably closer to $1,000 if they're gonna break even, especially in this economy. We drill,
That's where we're
yeah.
on that.
Here in the West, we drill more wells and put in more septic systems than anybody else in the state. We do. We do. And, so if somebody's making money on it, their fees have got to be through the roof.
But it's down, most well drillers will tell you they're down what, about 68%? About 68% over the past 4 years.
I know Bruce just six the dawned on me now when I pull up to talk to him. He doesn't come out and yell at me himself, so I know it's getting a little better.
It's getting a little better. Not much.
So we got right at $160,000 in expense for salary.
157.
Still doing well in space.
157,
Okay.
157, yeah, 157.
Well, yeah, we're still, well program is thriving.
It's still a statute. We got
Still there.
Still doing well.
And I think if we had those numbers, Jim, regularly, we'd be able to,
We can,
have that
we can
discussion amongst
produce that
ourselves,
for
and we
you.
wouldn't even need a bond.
Actually, we still track them, we just hadn't shared them out the
I know
door.
it.
And,
I knew you tracked it, I hadn't asked you.
Ron did that.
I just asked how many employees is that involved?
it's 3.2, I guess, about. It's the 3 environmental health specialists and a piece of Barry Patterson and a piece of a clerk. Actually, I think it might be 4, it might be the whole clerk. Yeah.
Anything else, Mr. Lazo?
Not for me. I think I've done enough damage.
Sound good, you do good work, Jim. The health department does a lot for the folks in the county.
Thank you.
And there's a lot of ask for you.
I'll give a shout out to the health board too.
I was
It's a
gonna
hard, it's a hard working bunch, and
Yeah,
I've
it is.
only been to about 3 or 4 meetings so far, so I'm still kind of figuring out where I need to be and what I need to be doing, but they've been patient with me, and I appreciate that, and they're a professional
It
bunch.
took me 6
Russell-
years to learn to read.
Russell does a fine job, so.
Sure, I still got it, yet I can't find the 2 legs, I can't find the head of some of these employees. But I keep looking.
Our challenge with employees, I've told Commissioner Cuppers this, when we produce that salary sheet for him, and we also produce one for the county that's by program instead of by person, the problem is our salaries are a moving target all the time. Because it depends on,
State dollars, federal dollars.
2 sets of books, basically. One set of books is what we actually have in our county budget, the other one is what we actually charge to the state. So though I'm 100% county money, when we draw money down from the state for family planning, there's a little portion of Jim's time that's calculated into a formula that they have that puts a piece of my salary state, but the thing that you have, it's 100% county. So, and that goes through every position in the building. It doesn't matter whether it's a health educator or a nutritionist. The only place that I can say, there's 2 places in the budget that one place, that I can say exactly what the dollar amount is in the budget for salaries is WIC. Because I can't spend the money on anything but WIC. But everything else in that building, it's a portion, that whole operations section.
Situation, I mean, there's not another one like it in the
Yeah.
world.
School ain't the same way.
Well, I mean, just the county, they're county employees, yet the county manager has no control over them.
But we got federal, state statutes too.
I mean,
It's got 3 cents of money.
Yeah, but we're the only state in the world
But you
that
don't
has
pay
that.
teachers 2 cents,
Yeah.
you'll pay half and half.
It's just state.
You pay on state.
The same thing to make it work out.
Absolutely. His are chopped. It's unbelievable. It's the most complicated.
So you sold the Cavaliers and we,
You can sell the Cavaliers. I'll
All I
park,
gotta do is buy.
whose driveway you
All I
want to
gotta
park
do is
in the
buy a
barn.
$5
So
hose.
you
You
gotta
got a
find
brand new
$13,000
Astro
in
van.
a-
I guarantee
in
you.
a $2.2 million budget.
Bobby's Auto down in Raleigh can tell you
That's
exactly
point
where that hose goes.
0
Well,
point.
you guys are really lucky because you've driven that Astro van that I know of twice to Raleigh. And the last group that drove it.
No, we
was
actually
Jet-
drove it, we drove it to Asheville instead of
Oh,
Raleigh.
I thought you drove that to Raleigh, but the
I
last
think
group
it's in
that
the
drove
winter
it
too,
was,
so we didn't notice it.
We didn't know the air conditioning workers in the middle.
the last group was Kathy McGahan and Jennifer Garrett, who broke down in the middle of I-40 and called me. I was in Raleigh and I went and picked them up and took them to a hotel for the night because we couldn't get the van fixed.
Well, I tell you what, yesterday they picked me up and rode that van, it was 400 degrees outside, there was 200 in the van. And I had a dress coat on.
Yeah, but I'm sorry.
That's before we got to see
But
Bobby's
it's
Auto.
it's
But
good.
the van's not one of the ones we want to give up, but we'll give up the Cavaliers as well.
Thank you, Jim.
Thank you, appreciate it.
Thank you a lot.
Russell,
Thank you a
thank you,
lot.
sir.
Thank you, Russ.
Candy, thank you.
Jim, we've got
I'll give you a call.
Seth is here, you guys.
Yeah, let's go to Seth and then we'll take a break after we talk.
Oh,
about it.
yeah, okay, that's-
No, I'm good.
Well, if he's good, I know Mr. Good.
Oh, man.
You don't mind
If we take a break, it'll be 10 or 15 minutes, you okay?
All right, with that? Okay.
All right, we'll stand to the break.
We didn't ask that.
All right, we'll call her back to order as a way of explanation. This goes back to some conversation that's been had for the past several months about recreation needs. And I'm just gonna say this as a disclaimer up front. This board is a conservative board. We've gone through and cut and we've given Jack direction. I think this, at least in my mind, is a separate thing, it's money that hasn't been spent Seth, help me out if I'm saying this wrong, this is money that hasn't been spent over the past 30 years, which I'm not blaming anybody for that.
Yes.
I don't think you are, I don't think Bobby is. I think what we're recognizing is that, yeah, we've had a balanced budget for 30 years, but perhaps we've not spent some money on recreation that we should have. And I think if you look, and I'd like to get some figures on it, just to guess, if you look at our neighboring counties, what they spend per population on recreation,
We're low.
we're low. And with that said, I don't.
And yet, if I could interrupt, just for, and yet, look at the quality of the recreation facility that we have provided with no more support. Now you come to the point where the infrastructure is starting to crumble. You can paint it, you can sow it, you can fertilize it, you can cut it, but eventually, if it's made out of steel and concrete, it's gonna start to crumble
Yes.
away.
And
that's where we are today.
And I told Bobby as our liaison to recreation that I recall when I just had my 50th birthday. I know I look 30, but I just turned 50. Don't laugh, Travis.
I did too, just last December.
And I just turned 50. Brittany, I haven't got socks as old as you
I
were.
just turned 24.
Okay. But I
Older
took,
than you are.
Mike, I took swimming lessons at the Macon County Recreation Park pool, and it looks exactly like it did when I was 10 years old. Okay? Now, and all I'm saying is,
Not exactly, because the concrete's crumbling away now.
well, I'm saying the structure, the tolerance level. So, the reason I'm prefacing this, and I think Bobby would agree with me, that I don't want to be appeared to be two ways with budget money. One, I think we need to be very conservative, which we are, on our continuing, every year recurring budget. This is something that's different. So, with that said, I turned to Bob and asked Bobby to do this, so I'm gonna turn this over to him and let him sort of say where this is.
And where we are right now is just in the information gathering mode, but I think what the chairman says is exactly right. We're not actually in our budget book right now, so I mean, you can keep it open if you want to, but it's really, we're kind of outside that. But we have this together. I wanted to give Seth an opportunity to come and talk to us about this, because for 25 years, I watched the United States Navy get told every year, you gotta do more with less, you gotta do more with less. And finally, towards the end of that time, we started to realize that there were sometimes you can't do more with less. Sometimes when the equipment's gone, it's gone. It's, when that air conditioning hose dry rots, it's gone. Okay, the fact that you haven't looked at it in 10 years because you never drive the van is why it's gone. Well, I don't want, I'm hung up on that van, but I don't want that to happen to our recreation facilities, because our recreation part and the activities that go on down there are a huge part of the quality of life. It touches people. If you don't believe me, go down there on Halloween or go down there on the 4th of July and tell me how many people in this county are touched by that recreation park. And for years and years, because Kevin and I were growing up when I was a little older than Kevin, about 6 months. And as I was growing up, that thing was the crown jewel. When that thing was put in, it was the best one west of Buncombe County. There was no competition, and sadly, it's not right now. And that's not Seth's fault. That's not anybody's fault. That's called you can't do more with less forever. So with that said, I asked Seth to go get us some information on a couple of the key parts of that puzzle, which is the pool house and the pool itself. He's gathered those numbers. He's got a few little pictures here for you so you can kind of visualize it. With that, we'll actually get on with this thing, and I'll shut up. You go ahead.
Okay, we'll start with the pool house renovations. I got with Steve Ledford to try to get a rough estimate, and he said, since we're not doing it, it would be hard for him to go through and get an exact number. So I contacted Terry Dalton, the first commercial contractor that came to Steve's mind. So we got him to come and walk around through us.
That hurts a little bit.
Well, that wasn't.
We're trying to keep you out from there,
New conflict of interest.
A little bit of one. So.
Bill don't want to give that what's going to happen.
Well, true, and I could have very easily.
That's what they said.
But
I vote no.
but one of the first things that he
brought to our attention right when we pulled up is that if we do one thing to that building, we have to bring everything back up to ADA code.
And let's say that sort of loud right here.
Okay, if we do one thing to that entire building, we have to make the building and the pool. ADA.
But the point is, it's not.
It's not right
ADA.
now. No, it is
And
not.
I think that's something we need,
It is not.
really need to,
And if
let
we're
it be a focus here.
and we're lucky that has never been questioned as of now. There is a sidewalk that goes up to the front, but it does not meet the slope requirements as it stands right now. I've seen people with wheelchairs go up and down it, and like I
And
said,
the pool itself does not meet.
no, it's grandfathered in right now. But once we make changes, we'll have to do a different lift. We've got a lift right now that we hook a garden hose to that will lower somebody into the pool and get them out. Well, it passes for now, but once we make one change to that, we have to bring everything up to par. The price that he gave me, and I met with him twice. We met one time, me and him walked through the building and looked at all aspects of it, and then we actually met again with Bobby Bishop up there just to be sure about all the codes and stuff that we would be forced to qualify. And he left, and when he came back with me, he said, on a high end, and I told him, I said, I don't want to have to go back. Don't give me a figure that looks good, and I don't want to have to go back in front of in front of the board and ask for more money. I said, go on the upper end of it. If it comes back under, that's how I like to do things. I do not like to come back and beg for more, because it means that we've not done our job the right way, in my opinion. So what all that $250,000 includes is just for the pool house itself. That includes getting a set of the sealed plans. And Ronnie, you know more about that than I do. That's a little more detailed than what I was even aware of. Is getting basically a biddable set of plans. On the outside, we have to tear up the sidewalk and pour a brand new one. Doing a little bit of grade work, not much. It's closed now, but the one that's there you can't pour over top of, so we'll have to take that one out and do a little bit more grading and re-pour it. The bathrooms on the outside of the building, if you go up to them right now, there's plenty of room on the inside to make them, but the doors they're that wide.
Yeah.
So we have to widen the doors, and basically while we're doing everything, we're going to make everything in there hands-free. By hands-free, I mean the automatic things where you don't have to touch anything in there. It does it on its own. Obviously, new paint. Some of the trim is getting old on that building, so that will be included. It's got a metal roof on it that we put on about 6 years ago that's still in great shape. So the roof is fine. The entrance doors, we'll put a glass facade, shatterproof door on the front and the back. The doors now look like they've come from the 1970s. It's basically, when they are.
Doors.
They are.
What's your point?
Moving on to the inside, you're bringing everything back up to ADA standards. Starting with a floor, we have to have a non-slip resistant floor. The floor we have right now, we paint about every 3 years. That paint just peels up, and basically what we do now to make it non-slip resistant is we use a latex paint and pour sand in it and paint it. But like I said, it doesn't last long at all. Being with that chlorine water coming in and out, there are products out there that are designed specifically for that that are costly, But if you do it right the first time, it'll last a long time, a lot longer than 2 or 3 years that we're doing it now. New paint and tile work throughout. All the tile in there is number one, it's outdated. Number two, it's either cracked or starting to come loose now. So all that stuff will be redone. The updated electrical, and that's on an as-needed basis. We may move some things around. We may move some of the toiletries around, so there may be some plumbing changes as needed also. New hands-free fixtures throughout the inside bathrooms as well. New changing in bathroom stalls. If y'all have been in there, there are shower stalls and these dividing rooms where you go in to change. That's what I'm meaning by the changing. And then obviously all the bathroom stalls, we've got pretty decent ones in there right now. That's about the only thing that's been updated since I've been here is we put the new, basically a hard plastic changing things. But whenever we get to moving it, we're going to have to make some, due to the ADA accessible, that will be ripped out and we'll have to put new in. The new ceiling, we'll put a different, right now it's just plywood, put something a little sturdier that we can spray off and clean. New lights, we actually already have the lights bought, and I didn't tell him at the time, because everybody's going with the smaller bulbs now, so we have enough lights in stock to light the facility, and updated airflow. The ceiling fans or the attic fans that we have right now don't exactly pull air through there like it should, and it gets kind of stale in there, especially if one of the doors gets shut in the afternoon.
Does that figure include air conditioning?
No, it's a total seasonal building, so it basically what we figured is there's no need for it. The doors stay open and shut so much that.
What about on the concession side, say?
It does not include anything on the concession side. We've not had a concession stand in there forever, and mainly because the last 3 people that have ran a concession stand at the pool have not made them enough money to pay somebody to sit in there 5 minutes an hour.
You don't want the food trying to get that.
In my opinion, if we did it, we would need to. Are you familiar with the layout? As you go up in there, there's a huge big space in the middle between where we take the money. I think the back side of that, we could easily put a candy bar stand up. I don't think we need to get into serving the hot foods and stuff. I'm thinking candy bars and chips, which we could do. I know the county's never got into buying food and things, but that may be something that we could.
But Seth, part of that
do.
is chicken the egg. You don't have a lot of concession sales because not a lot of people come out there.
Yeah.
And some of that's because of the disrepair. You know, I think
Well,
that might be something that you could look at.
Yeah, that too, but a lot of the patrons that we do have are these camps, and they're paying customers. But now that especially summer day camp is not ran through the rec card, those kids aren't allowed to bring money anymore. They do their own snacks and things. Most pools anymore, unless you're at a private country club, have gone away from having the full concession stands. I think we have a drink machine, and like I said, if we could either stick with the vending machines, which we make a little profit off of, or we could.
It's a convenience.
Yeah, it is.
Or
It
just
is.
do some snacking type things.
Yes. Yeah.
So you'd keep that building over there from what you were saying, keep it with the storage.
The building that's in there now is totally full of fast equipment. The Franklin Amateur Swim Team, that is their storage facility now. While it was a concession stand, we started, there's new health codes required. We were going to have to put about an $8,000 hood in for them to be able to basically cook in there. We didn't decide to do it. All the equipment was basically borrowed by the person that was leasing the building at the time, so they gutted it whenever they moved out, and we just never put anything back in there because, like I said, it would not pay us. We wouldn't make the money back to pay somebody to sit in there, you know, and anybody leasing it, they'll do it for a month and they say it's not worth us, you know, worth us being there.
We really only got about a 4-month season with that
Yes.
anyway.
Yeah. So we've not touched that side of the building yet. But like I said, I think that we could easily spruce it up too while we're doing this as far as paint, but that's not in this estimate. Obviously, we would want everything to look the same out there. So some of the outside work, our guys can do that in no time while we're doing everything to match the color scheme and everything else. And like I said, the number he came up with on the high end was $250,000 to be safe. All the changes and things that had to be made to that building to bring it up to ADA code and bring it basically back up to this century where it looks like a modern facility, which is what we're shooting for.
What was the time span?
Actually, the time's not going to be long. I think that if this gets put in, we will start on it right when the season's over with, and easily by cold weather, it'll be done. You're talking.
So it's ready to open next season.
Yeah,
That's the point.
all of
what we're
this,
trying to do. So,
yeah.
Mr. Chairman, do you want to go ahead and have a motion to authorize the county manager to contact an architect, an approved architect, to go ahead and get some plans? We don't want to talk about to get some prices. So, I mean, you can get a set of plans. for
Probably
all.
ought to do that, but can we do the whole package and then do it all like that? See what I'm saying? That's, we're not doing.
Well,
Just
but this is
pull it out.
different.
This is different. I'm happy to do that, and I'm happy to make
But
that.
see, the pool's a whole different.
It is two separate.
It is.
Once you
So
make
why
a
don't we do
change.
that- Why don't we do it that way, if that's all right, Mr. Chairman? I'll be happy to make the motion that we authorize the county manager to get us, contact an architect, give us some plans when we start.
That'd be your recommendation, Mr.
Oh,
Contractor?
oh, yeah, and that's what you gotta have,
Yeah.
and the only thing that is, there's no reason, get the plans ready, get the suit set, if the county manager thinks it's okay, there's no reason to put it out to bid. I mean,
Correct. Correct.
because it's changing, I mean, the whole, you can't, the windows you used to buy now are 6 weeks out, there's no inventory or nothing hardly, it's hard for anybody to bid anything.
Yes.
For, on a long range, you just
Mhm.
can't.
Right.
They can give you estimates like you got here, but to really put it out for free competitive bids.
Yes.
I think the county manager would
gotta
probably be
have some bid
difficult.
specs,
Have some
yeah.
plans and
You gotta have-
specs.
You have to walk over.
I said, yeah, you're gonna
You're gonna have to have plans and specs to be able to.
Yeah.
People feel that
specs.
you
So
could-
I'll make that.
So if you get the plans and specs started, you won't be much, it'll take a little while to do that, so.
That's second. All right, we've got a motion by Commissioner
Where
Cuthbert,
we gonna
second.
fund this from? It's gonna pop fund this from.
I would suggest whoever made the motion, Mr. Cuppers, that money be taken out of fund.
Current
we
year,
talked-
next year.
This year.
This year, current year.
Current year.
Thing is, I mean, it's probably gonna carry over, to be honest with you. I mean,
I-
we've got
do
one
we
fiscal
have,
year.
do we have anything left in contingency?
We've got, it's like 30-something thousand.
Oh, yeah, that's plenty.
Well, that, we're just talking about plans. How much would it cost, I said?
Well,
The plan-
here's the thing about it is if you hire an architect and it's over $30,000, they gotta get you all to pass a resolution allowing me to negotiate with an individual. Waive that requires a state law.
You mean just the architect? It won't be nowhere near 30,000.
No.
It was less than
I
that.
can tell you what I think.
All right.
With 250,000, he estimated at 250,000.
But do you think an architect or whatever you have to hire to get this done in 30 days by June 30th? That was my point. We may have to come back to you and carry it
Yeah,
over.
yeah.
Because, you know, we can't pay for work that's not
But
been
his
done.
fee for specs and get everything stamped, you're looking at probably less than that.
So how's the best, I'm open to suggestions. How to-
Don't put that in the paper where the architect will see that and say, okay, we'll get for
What you're asking, I think
We don't know
what
that.
we're saying, let's authorize.
Well, contingency's gonna
Go
wind
ahead.
up in fund balance anyway if it gets carried over.
Well, it's going to either way, and it's. and
So
you're
why
gonna
don't we
have
say
to-
contingency, and then if
Yeah,
it gets
yeah,
carried
well,
over, it
the
does.
The reason I was asking for that is because we did make somewhat of a verbal commitment to look at that security system in the Highlands Library, so get that done before the year's out. We can, so we're looking
In
at that.
contingency.
We've got 41,000 in contingency.
And that does or does not include the,
Now, I don't know how much the security system was, you have to deduct from that.
okay, so
Just
that's
say that.
41,000 minus the security system. You remember that?
Security system was, it was 10, I said 10 less.
We're still sitting at 31.
I think that's fine.
And I've changed my, alter my motion, Mr. Chairman, to say take the money out of contingency.
You accept that,
And the
right?
amount, I think you need to kind of tell me, I need an amount.
The amount of not
Do a
more
budget
than
amendment for
20?
it, you know
Not
what I
more than
mean?
20,000.
Do you want to say 20,000?
Not more than 20.
It's to give the county manager authorization to negotiate.
Yeah, that's right. The motion is that the county manager has our authority to negotiate, money to be taken out of contingency, not to exceed $20,000 for that.
And with respect, we asked me not to print that figure because we don't want, if we can. if
Oh,
we
I'm
want-
ready.
Uh-huh.
Well,
I'd
Bob's
rather-
got it on the TV, what are you
I'd
talking
rather you
about?
write it.
If you need to, that's fine. We're just letting people know how much money we're allocating. But anyway, we have motion second. Any discussion? All in favor, say aye.
Aye.
Opposed? That motion passes. Now, the second part of this is the pool itself.
Yes.
So Seth, if you would, turn to page 2, gentlemen.
If you'll pardon my kind of poor artwork.
I don't understand that.
Planes and those on my face.
The first drawing that you have is how the pool is now. It is one body of water, which if you go to most pools now, most kiddie pools, yes, yeah, that one. Most kiddie pools are not connected to the main pool.
We won't go into the reason for that, but you
Yeah.
can figure out right in your own mind why that's really not a very good
I can't
idea.
figure that out, Bob.
You do not want an accident to happen.
We'll go
Maybe
into
people
closed
have to
session.
shut
Oh,
the
has this got
whole
something to do about the yellow water?
Yes,
Yes,
that is.
yes,
You
well, we're more talking about Hershey bars and things, but anyway,
And just on a serious note, because Matt Lifeguard out there for years, if an accident happened up here,
The whole pool
we shut down.
the whole pool
We
shuts
shut the
down,
whole
send
thing.
them all.
Yeah. We have recently, 2 years ago, redone our filtration system to where we don't have to lose the whole day now. I got enough filtration now to where we can turn the water over a whole lot faster than what we used to. It used to take 8 hours to turn the whole pool over, which is what's required by the health department. And now it does take about 3.5 hours. We have a brand new pump system, like I said, that is working great compared to what it used to.
It's a no-brainer tip for you.
Yes.
Yeah.
Um,
Second page.
The second page is what it would be. I have met with the folks that put our pump station in, this Crystal Clear Pools and Spas. They are one of the largest pool contractors in the Atlanta area.
They do seal this.
I don't think they did seal us. They're doing
The nicest kitty section I've ever seen.
exactly, and that's what I'm basically. We're losing people from here that are driving across the mountain to go to the pool
Well, no wonder.
because
I
of
mean,
that.
if you ever over and saw it, it's
I
all
have.
kitty section.
Yeah, it's and basically that's what I want to get to. If you'll notice, we have totally lopped off the large pool, the lap swim part of the pool, and the kiddie pool. That will give the swim team and anybody that when we have these swim meets, it gives them a whole nother lane that they can utilize because they'll now have a wall to push off of. And what their plan is to come in and basically build the pool inside of the pool that's there. They don't have to do any grading. They can lay new pipes. They can plaster over top of that, and it actually makes it stronger. They said they do it all the time. That
You
is,
just leave the pool there and just
Yeah.
do
We
it.
really
in
just
the
set
pool.
the pool inside the pool.
yeah, you're setting the pool basically like he said inside the pool. Now the shallow end, we'll have to dig into what's there because we can't lose 6 inches in the 3 foot because of the flip radius.
Yeah.
But we'll lose 6 inches everywhere else in the pool, but 6 inches anywhere else is not a big deal. It actually saves us a little bit on water, if anything else. Going back to the,
In the top part there, well, maybe you're talking about that, you talking about putting lack of a better term, the mushrooms.
yes,
feed
and
stuff.
if you'll notice, the far left side of that, it will just remain about a 2 foot deep kiddie pool. And it will gradually get deeper all the way out. There'll be a 0 entry. There will be no steps that go into the kiddie pool now. It'll be just like a beach going into the ocean. It'll gradually get deeper as it goes. And there'll be one of those mushroom features, which I did a picture of if you're not sure what that is. In the middle of the baby park. And then up on the deck, as you walk out of the water, the other pictures is of a splash pad. Those are the most popular things out today. I mean, anywhere where there's a splash pad, we could have that up on that deck and not ever open the pool, and we'd still
Fill it up.
Yeah, if you've ever been down to the Greenway on a hot summer day, those kids are all over that one all the time. This is going to be a little bigger and a little better than the one that's down at the Greenway.
So that splash pad looks, if it's by scale, you look at about 30 by 30.
Yeah, roughly. That was the exact size.
Okay.
And basically, it's a circle of hard rubbery. Yeah. That'll be up on the deck outside of the pool area.
And this would include new concrete around the
Yeah.
deck, for the deck area.
And we can go to their bid page, which is the last page of their, of Crystal Clear's page, and it's broken down a little bit. To rebuild the pool and make the beach entry into the kiddie part is $178,500. To install the splash pad and that rain umbrella in the middle of the kiddie pool is another $47,900. And then to remove all the concrete that's there and pour new is $126,390. In my opinion, I think we can do that cheaper, just because they're a pool company. They're not in the concrete company. Even though they do some of it, something to that scale, he admitted that day, he goes, that's kind of out of our realm. We usually do about 6 foot around the pool, and that's it. We don't
So,
do.
the first two items would be things that his company could and would do
Yes.
turnkey.
Yeah.
The third one is something that you could bid separately to a concrete company.
Yes, and they
That's
said,
what he would charge if he's just gonna contract it out.
yeah,
He's
he's
just-
got
so
one
we're
guy
paying
on
two
his
people's
staff that
profits.
does that, but he always finds a local contractor, and he comes in and works with them, because all he does is he does the edge that goes into the pool.
So we'd be better to sub that ourselves, would he, as a contractor, but he'd add 20%.
There you go.
Roddy's contractor for living set, I
Yes.
didn't realize that.
No, but I'm not one of the chosen ones.
That's not a source.
You'll probably get that done about 91,000.
Okay.
It's according to how, because we went through this, I think the manager was sure we went through this once before. On the pool. Did we ever take, maybe that was before?
So we've done things on the pool system.
But the way, removing the concrete is the worst part of the deal.
Yes.
That's the big, where the money is.
Does your 91 include that?
We've got a nice river bank down there we've built on.
You might as well set aside, you might as well look about $320,000.
For the pool, 250 for the building.
Yeah. If that's, that's counting everything.
I was figuring about 600,000.
I'm thinking the building's not gonna cost you $250.
I'm not able
Somewhere between
You're somewhere between 5 and 6 for the whole.
I think you're closer to.
Well, if you take the figures as they are, it's 566. So if you got it done a little less, you look at maybe high fours.
Yeah, if you get it for 500,000.
I think it's $500,000.
That's what we
But on the other
started
hand,
out thinking.
I mean, this pool was put in 1976.
Was it 74?
I think the whole rec park was open in 74.
We picked up rocks when I was a freshman, when I was a senior.
Well, I was gonna say, my little stories, I took swim lessons there, and I was only 61, so I've been 13, that's about right.
And if y'all go anytime soon, it is on this last. We're gonna have to do some maintenance to it,
But-
one way or another. If we do this,
It's amazing,
Or
you know
not.
how old that, look how it's held up.
yeah, it is. It is.
Now, you talk about quality construction.
Everybody that has came and done repairs to it since said they did it right the first time.
Oh, yeah.
But it's just so happened they just don't last 30
But,
years.
but rather than spend money to
Or
upgrade
longer than
something,
that.
Yeah.
it's not gonna, I'm just saying, part of the conversations I've had with Seth is the differences from when we were small and maybe when even when the next generation that was a real nice facility compared to others, and a lot of people went there. You go out there in the summertime, yeah, you'll see the summer day camp, because they get hot, they get bussed out there, I don't choice. But parents take their kids to the pool.
Yeah.
It's not happening.
No, not as much.
Let's just be realistic.
And
It's not
they're
happening.
driving to Waynesville's Rec Center, and they're driving across to Jackson County just because kids, they get bored with just swimming now. They're in the video game stage. It takes a little bit more to entertain a kid now than it did 30 years ago. And they want
And the
the bells
pools
and
now
whistles.
is for the 2.5 and 3-year-olds that can go out here and hit his, you go to see it anytime. We've done a job right, well, that's all the other day.
Yeah.
At 10 o'clock in the morning, hit one. With 2.5, 3-year-old, 4-year-old kids.
Yeah.
And their parents, or moms, or.
See, and if we have something that will draw them there, I can stay open longer because those kids aren't in school. The way it stands right now, I have to shut when my lifeguards. I'll have 2 or 3 extra lifeguards that won't go to school. But as it stands right now, I can open after while school's in, but I might have 2 people there.
Let me ask the technical question, Mr. Manager, on this amount of money, this would also have to go to bid. This would, you'd have to find,
These are specs.
you'd have to have blueprints, specs, and you'd also have to go to bid.
It would be.
So we needed,
Did we just replace some coronators or pumps or something out there? What was it?
Yeah, I redid my whole pump system. And that's why none of this.
That's not included in
No,
this.
and there's no need for it. We're up to date on our filtration system. I can lop off.
$100,000.
Yeah, I can lop off one of the pumps, and it runs. One of the pumps that they put in is enough to run the whole kitty side of
I was
that.
gonna ask you that.
So
That's-
yes,
we're good.
there's
We're good
very.
for that side.
They actually when they were there designing it, I told them in a perfect world, because he looked at me and said, this is kind of an odd layout. And I said, yeah, it is. I said, in a perfect world, I would like to stretch out this wall to make it into 2 pools. So the way he designed the plumbing coming in and going out, he said, you'll be able to do that easy and lock off one of these and it'll run the kiddie side, and the other, the other 3 or the other 4 will run the main pool. And, and I'll still meet the requirements of turning the water over on a,
So, Mr.
on
Bill, what we
a
need
right
to do-
basis.
Well, I think you need to authorize the county manager and Seth to get together and see if, number one, this has to be what they do. I mean, to come up with specs on this, you have to have a pool company to do that. So, these companies don't want you to come up and use their specs to bid out to another company.
No.
So you're gonna have to ask, you have to send them basic knowledge and let them send back to you what that includes, with the specifications included from the, if you can find the bidders to do it. And I don't know who else does it. Asheville Pool, they used to do it.
Who does?
And Highlands Pool was done by,
Sure, I use the Medallion Boards.
yeah, but there's another, these were from Greenville, South Carolina, I believe. I don't know, but I mean, that's what you have to do,
Yeah.
say, this is what we're looking at doing, that each have to come to the job, and that each have to send it in, and it leaves the discretion of the manager to,
So you can take bids from that.
You gotta have, if you're gonna ask for bids, you gotta have the same thing that everybody can quote on, so.
Right, quote on the same thing.
you can make some generalities, but
Comparable.
you just have to be real careful that it's apples for apples. Read that. So I would just say you authorize the county manager to, we don't know what we're talking about, if it's 400,000 or if it's 600,000, until we get some hard
Let me
numbers.
understand what we're talking about. You're talking about, these guys can take this basic information and you can draw up some specs. They can do it.
They've got some, well, it depends on how much or how little you wanna do, so you gotta put that into it too. If you go to one of these pool contractors, and says, I want you to put a pool in, I want an Olympic sized pool behind my house, he'll flip out the book and say, which one do you want? And they already got the plans laid out right on it.
That's right.
And so they know exactly what they got and how much it's gonna cost and how much profit they're gonna make off of it right then. So what you need to do is figure out how much or how little that particular area of the pool that you wanna get done. I think you got a lot of that done
I
already.
think that's what it says.
You
Yeah.
can give them general measurements, tell I want to come and look at it.
Well, and that's basically what I did with this company. I had them come and we walked around and I said, this is what I want here, this is what I want here, this is
You
what I
got
want here.
16,800 foot of, if you're gonna take that cantilever and the coping out of that, you just need to be real careful, because when you're doing pools,
Well,
you put,
In my opinion, I would like to leave the 6 to 8 foot, because there'll be a drain deck in there.
Yeah.
Now, the drain deck that's in there now is a strip that runs around.
you're gonna leave the coping in there for sure.
Yeah, and this guy says that, he goes, that doesn't work, you gotta put a drain system in. I would like to let them do the 6 to 8 foot of just base concrete that goes into the pool, and pour all the outside stuff with a local contractor that's just a straight pour, that's over top of the pipes and everything else. Yeah, I think so. That's what they don't,
They prefer you to do that too.
and I think so, because I
That's
think
what
they
they're-
would end up losing money on it. I think that they want to do the technical stuff around the pool,
Yeah.
but the just normal deck, they don't want to touch.
But I think you'd probably start, Mr. Manager, with, getting with SAS and getting it narrowed down with some better facts and contacting these folks and some other folks, say, listen, if you can't get nobody interested, now that the county manager does have the ability to go ahead and make a deal with these folks.
Okay.
You just have to see who's interested, but he has that authority. You can advertise it one time, you don't get the bids required.
Did you negotiate with,
We'll make sure our attorney approves of it before we.
Oh,
Yeah, that would be a real good thing to do, yes. Yeah, we were kind of.
Chester might have some.
He might have
Have
something
something to say about it.
I wish maybe, well, that sounds
So-
good.
so-
Is that,
Do we need a motion for that, or?
I think it's just consensus, if you can just get a consensus, Mr. Chairman, of the board, there's nothing we're really approving. There's no money outlet.
we're authorizing them to take an action. Do we need a motion to do that, Jack?
Would you feel better if we had?
I think you can do it either way. You can do it by consensus, or you can take a formal motion on it to make a difference. But probably, for the record, it'd be good to have a motion.
All right, let's have a motion to,
But I make a motion that we authorize the county manager along with the rec park manager and our county attorney, and our finance person to start an investigation on the procedures to get estimates and bids to upgrade the swimming pool to Macon County Rec Park as outlined by the Rec Park Director.
Second. We have motion by Bill, second by Cuthbert. Any discussion? All in favor say aye.
Aye.
Opposed?
Did they teach you how to swim when you were ten years
Greasy when we don't have to spend any
They
money.
are
Yeah,
brothers.
really
They are.
easy about
Did
that.
you learn how to swim when you took those lessons out?
Yeah, I got my life saving and all, I got certified. Life saving. If you go drown, I can pull you out.
I was raised in town. We didn't go out. You was raised in town. We didn't worry about things floating in the water like in town.
Well, I think they can just cancel it.
It's hard to swim in, it's hard to swim in these.
Joe Abbott didn't matter.
While the rec director's still here, and in fairness to my colleague from Highlands, we do have some requests from Highlands with respect to recreation. I think y'all should have gotten the email.
I just sent it.
You sent it to me? Oh, I didn't make copies of it,
I've
I'm
got a
sorry.
copy of it.
Good, yeah, if you could, want to make copies, let them see.
Yeah, actually, there's only really, I'm not
Yeah, we
crazy
talked.
about it all. They're basically asking for $20,000 to 25,000 to repair their pool. It is frequently used, I can tell you, like 2 to 3 times a week. They're just looking for 25,000 to repair cracks and resurface the interior wall and so forth. Reduce that.
Can I make one other pitch for you?
Yeah, you can.
Because I've talked to my rec director, and he tells me that while he doesn't think it'll cost $4,500, he does think that the work on that field needs to come.
Absolutely.
And that's the reason I want him to say this before he left, because we don't think it'll cost that much, but I did share this with Seth, we talked about it, and we think that definitely needs to be done.
Yes.
So, y'all want to pass that down, okay, I've got it memorized.
Was that the same thing? We just need to get a hard number? Jimmy, is that what you're?
He just gave us some good, budgetary.
Yeah, I think what we need to do is go get hard numbers on the Highlands building, and I think,
Some of that stuff I don't think is necessary for us to attack.
We'll just tack it on, made
you made a motion,
You
I
probably,
just amend that motion that we also, while we're doing the pools, have the county manager and those involved to also look at the renovation required.
I would be shocked since it's not a local company that's gonna do it, if the same company wouldn't give us a better price for doing both.
Well, I just add that, if somebody, I just add that.
I'll
to my
second, I'll be
motion.
happy to have a second, yeah.
While we're doing it, just do it all.
Any discussion about adding the house project to that? All in favor say aye. Opposed?
And I'd like for you guys and your rec guy to talk with Seth and then come back to us, if you would, on the field, because I really think you need to do that. That gets used by a lot of folks.
Is the girls softball field holding up well? Seth, that time we put all the drainage in, done a lot of work on it. Is it doing well?
The girls softball
Or the
field,
Highlands, next to the school,
next to the
you
school?
may not be.
You may not be
that's
Is
not
it
one of
holding up?
ours.
We put new drainage in.
Girls softball fields are hanging in.
Is it doing okay?
At graduation, Bush Smart crawled out of his chair, the best of his ability, and made his way over to me. I didn't know he was coming to see me, because a lot of people made his way over to just compliment me on how good softball.
Good.
Might be good.
To thank y'all, basically.
So you know the field that I'm having them discuss is the one exactly.
Oh, Zachary Park.
And
It's-
its
yes.
infield needs some work. We don't think it's gonna cost.
Everything that's went up there to play so far this year has came back to meetings and asked, hey, that lip's bad.
Or grass me seed
Yes.
field.
Yeah.
Yeah, they had a problem with that last year.
Anytime that you just lay sod right on top of the ground, you've got the dirt that the sod grows in, and you've got the sod on top of it. If you're gonna put a sod infield down, you have to cut down below the surface of the rest of the field and lay the sod in. And a lot of times that doesn't happen, and it gets bad over wear. You know, people just dragging them. If you drag a field in the same way, it eventually throws dirt to the outside.
Do you have an issue with getting with their guy,
No,
Jimmy?
and I speak with him all the time.
We'll figure out how to get the money to.
Seth, I got a question. I want to ask you.
Okay.
How much is per person it costs to get in?
It's expensive.
what I'm
It's $2 a person if you're over 5, and it's $1 if you're under 5.
Okay, now, if we upgrade this pool right here, I'm talking about
We-
Sylvan Wayne, what do they charge for entrance? Or do you?
We can double.
Yeah, they got a rec center over there, they got a pool with a rec center built
Yeah.
over top of it
Yeah.
over there.
So they basically have a membership, so it's nothing to get into the pool if you own a membership. Now,
You can get a pass for good to so many,
Yeah.
for so many trips.
we will probably, I mean, in realistically, we need to double our price if we make these
Beautiful.
improvements. Well, and that's what I'm saying. It's still nothing. I mean, comparatively.
But you're gonna have, if you do that, one, you're gonna have a facility that people are actually gonna use.
Yes.
You're gonna have it as a destination, people are gonna leave, go into that pool.
Yes.
To use it. And you're gonna have more user
Yeah.
fees. I mean,
Yeah.
not that it's gonna pay for $500,000 a year, I'm not sitting up there last year. You know, you're gonna have increased usage.
Yeah, you are.
Well, it's just
The whole park.
Well, if it lasts 40 years like this other people,
I mean, it's amazing how that red park's held up. I mean,
It is.
It's 40 years old there, and basically no change.
No.
Well, and I talked to Seth about it, the thing about the park, you've got the picnic shelter down there is in decent shape, it
Yeah.
works. You've got playground probably needs some work, but you've got the ball fields are certainly decent ball fields.
They are.
Kept up, great grass is kept up well, these guys do a great job of keeping the infields and I, Seth played softball too, last 20 years I played softball in every field.
Yeah.
But they're good.
Yeah.
But the pool's not that good, and that's.
No, the pool in the park itself, the pool is the worst thing about it.
What kind of time frame are we looking about here? When can we get these?
Well, you can't really do anything out there on that until after this season.
Oh,
So
agreed,
Yeah.
agreed.
So you gotta work
Before next
through
season.
this summer to try to get it lined up so that you can start.
In speaking with if we can get it by the end of the summer,
Yeah.
in a perfect world, this pool company said that they would like to come in as soon as we close, lay the pipes, do all the concrete work, and then leave, and then come back right before the season and basically plaster it. They said there's no need for plaster to sit over a winter. That saves you 1 year of longevity over the whole thing. They'll do everything.
Anticipate closing the pool in the middle of September?
No, usually we use about middle of August. We'll open weekends through August. When school starts.
Go back to school.
Yeah.
We get,
starts.
we get these plans drawn and what, I mean, I'm asking about what's the time frame? What's the
Well, you just have to let the county in for contact, and I think
Well, this
You just have to get started.
Right, so,
Yeah.
it'll take us a while, several weeks.
I think the specs and the drawings on the building is gonna be much easier than getting the 3 pool companies to agree to a general set of specs. I mean, Ritter can take this and he can have that done, he probably have it done in a week.
But Seth, can't you take, and I'm not an expert on this, but can't you take the information that you've gone over with that pool company? Take
I
their
can
name
get
off
them.
of it.
Well,
and
if you
just
look at
write
their
that.
bid, there's a lot of hidden stuff on there. They didn't send me all the exact things. He knows, and that's basically a rough estimate with him too. That's the basic stuff. I've not got into the number of valves and the number, with them yet. But now he knows, and he said that if this is a possibility, they're willing to do that. And then at that point, yeah, I would take their stuff and basically be able to take their name off of it to give to somebody else.
You can make them understand, there are just certain things that we're constrained by. We
Yeah.
have to do.
Well,
But
and
if you're
and they understand that.
In my simple, well, if you're comparing apples to apples, you've got to start with something.
Yes, you do.
So if this is what you want, you need to write that down
Yeah.
in whatever way it is.
In any form you want to, and then get that out there and see if there's any other interest. The name of the game is getting.
And when you're gonna bid this stuff out, you're gonna have to make sure that you put in there something that doesn't restrict it to one particular company.
Correct.
Right.
You gotta write it
Correct.
down.
That'd be fair enough. That's right.
All right. Okay, everybody done?
Thanks, Steve.
Thanks,
Thank
Steve.
you.
It's not bad.
Appreciate your time.
All right.
Thanks, appreciate it.
Yeah, like I said, for 40 years, last another 40 years, we'd be in good shape.
It's a good
But
point.
back in '74, they made Cadillacs that had quality. Now they look like Cavaliers.
Yeah.
I drive a Cavalier.
Is it white? Is it white? And do you have a silver plate on it?
Get that on there, boy!
it on it. Okay? I'll get her a sticker that says
Bless her
Cadillac.
heart.
put it
All
on
that
the
like
plate.
about
Sorry,
if your air conditioning quits, I can fix it.
we're gonna sell 3 of them up here.
I tried. and I-
Call him on Cavalier,
It
didn't
actually does have a bumper,
Yeah.
it has 7 of them, but still.
Gentlemen, we've been bouncing around
Let's
quite a
go.
bit here, but
Where we at?
back to
Yes,
the,
yes, I guess.
if we end with the health
We're on
department
page
stuff that we're
67.
starting.
67.
67, that's right.
On the DSS,
Correct, DSS administration. Does anybody have any
The biggest thing on that is $1.5 million that's coming through the state, going through DSS instead of going direct to the daycare provider.
Nice.
Outside of that is not
But
Makes
that,
our
that,
budget
that
look
adds to our
$1.5
budget, but
bigger
it
than
That's
is
it
our
is.
budget, but
it's
doesn't
not
add.
county money.
Let's
It
say
adds to
that
revenue and
loud.
adds to expense, but it doesn't, it does not include any county money.
Yeah, that's right.
Right.
Let's make sure we understand that we're $1.5 million bigger than we would have been, and this money's
All
just
they're
going
doing
through.
is channeling that money through the county DSS instead of going directly to the Southwestern Child Development.
and some other things that DSS is going to inherit, and they already started, with not only the child support, #1. What's the other one, Mr. Major, remind me? That,
TANF,
no, not TANF, I'm bringing it. We talked about it down there. The DSS now has to, what's the people, the guardians of the court,
guardian ad litem.
guardian ad litem.
Yeah,
That's also come through DSS now. That's new.
that's new because it was a separate standalone.
It was a separate standalone, that comes through DSS.
All right, gentlemen, anything else on DSS on those first pages, or flip through, it's a couple more?
Yeah, there's several pages there.
That goes to-
DSS goes through,
76.
yes, that's correct.
If you look at what was recommended and what department recommended, and what the manager did, I'm not saying that some budgets are, but I will say this, just having served on that DSS board, and Jane Kinsey, it's sort of amazing how she.
When they're in Academy magazine, they go through with fine tooth comb.
It's,
I met a lady in Raleigh on this trip that said, boy, you're from Franklin, said, Jane Kinsey, and she just went on and on. And I said, we're
Jane's
aware.
ready to be a grandma, you know.
Yeah.
I tell you what, we're lucky to have employees like
Oh, man, their clock's ticking.
Any other questions on the social services budget?
None.
I don't have any myself, so. Ron? Or Jimmy? You turn on then, I guess, 70, where we said it ended?
It ended on 76.
77,
Mental health.
mental health.
Oh, I can answer that.
So their budget
This
is
is the way we left it, it's the
Same.
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 It's actually the same. It's, just a little bit about mental health, Mr. Chairman, if you don't know. We go live July 1st with Medicaid waiver. Smoky Mountain now is going to be probably is going to be watched by close to the state, of everybody. According to the Secretary of Health and Human Services, got to have records with you for that. And so it's going to be some changes. It's going to help the problem that the sheriff talked about. Not until they get a place to place these people that need the help. But Medicaid waiver is a new way of doing business. Smoky Mountain LME now becomes a banking insurance company. What they become. They have X amount of dollars for X amount of population for 15 counties. And the goal is to have some savings there and improve services. Services have improved, emergency services. So we'll see. That's all I have. No, it's important. Big time.
JCPC grants.
Juvenile Crime Prevention Council. That's money that's appropriate, the county matches us with a 30%, I believe it's a 30% match. There's only one thing that I mentioned on here is that one of these, I think it was, what was that first one?
It's the first one, Barry Variant Springs.
Variant Spring project there. Got additional funding during this year, and we made a budget amendment to that. The latest word that we've gotten is that they're anticipating to get the same level of funding next year as the revised budget for this year. We don't have that smaller, that additional matching portion there, but it's only $1,000 more than what we see here. So, that's the only other change that we've seen. Everything else will be the same.
Is that June sixth event or whatever,
Yeah.
June something or
I'll
other?
tell you when it is, if you don't put it on the calendar.
It's a luncheon, isn't it? And tell a little bit about
I
what
think
they're
y'all,
doing.
it's on your calendar.
I will go if they're providing food.
It's on Wednesday, June the sixth. Wednesday, June sixth.
It's next week. At the,
It's at their building here.
At 11:30. 11:30. Tell them to go.
11:30.
But that's a program that basically the JC Mississippi is on.
That's why I saw it.
Where's that at, Ron?
I just saw.
Tell them the Georgia Road. Right there,
I just saw.
a lot of pipes, the hills, outfield paving is on. Doesn't happen. Brian Springs.
Just past June days.
You know, the veteran services, everything seems to be about the same except the salary amount is down. I think is that because you changed?
Change.
Yeah. So that's pretty much what that is.
And one of these days, you know, when this manager knows that you can't do it in this budget, but as more and more demand becomes on our local veterans office, they can stand some more critical health hours. And it's just not, but it's coming.
Fortunately, we've got two qualified people to work with our veterans, and they both have a lot of experience. Actually, I think Jackson County just had one person working there.
Feedback I get is good.
Oh, yeah.
They do a really good job, but,
And part of
it's a
it-
continuing increase, will be a continuing.
Oh, yes.
And part of it, as a veteran, you know, Jack, that the veterans become more aware of what's available through the Veterans Administration because of the education to the veterans, which for a long time was sort of, if they didn't want them to know.
They don't wanna know, you don't know, all you used to, all you could get was, all you thought you could get was a flag and a tombstone, you know? There's a lot more to it
That's
than they offer now.
I tell you
So
what,
you have these veterans organizations like the Vietnam Veterans and
They're doing
American Legion,
education and
and they're
that's
doing
right.
it, and they're getting,
I'm telling you, if you stood out there in the park on Monday, you know there's a lot of them out there.
And the other thing, we have the Veterans Clinic here, which is another drawing
I
card.
was gonna say the big thing, a lot of vets are taking advantage, we see it in our insurance business, is a lot of vets are taking VA benefits. Years ago they wouldn't, you know. A lot of them do it, seniors doing it because of the medicines. They can get a Medicare supplement, but they like to
They
take
get
the
medicine,
medicine.
they get eyeglasses, they get
Free.
hearing aids.
Too bad, right here, are some of the biggest dollars they spend. Eyeglasses and hearing aids. That's
what?
exactly right.
Because Medicaid don't do it.
That's right.
Jumping on seniors, next page, 80,
All the way through 85 covers your different parts of senior services.
senior services.
As liaison to that department, Mr. Chairman, if you look down the list, everything, what there was an uptick in is just, it's very minor. Mr. Manager, you want to speak to anything? I don't know with,
I think we had an increase in adult daycare.
You okay with the budget, Mr. Lowe?
Are you looking at that one, the adult
Yes.
daycare budget?
Yes.
We had an increase in there, adult daycare and a home aid contract, transportation contract, so that's going up, and that's, the good thing about senior services that we didn't have before is that it's, right now, currently still part of DSS, which means we get a reimbursement on a lot of money that's spent, whereas before it was standalone department, the county paid 100% of it. And so you would get a real good return on money for that.
Jack, I had just one small question on the administration part. You had $19,246 in outreach, and that went to zero. What is that?
And let me find it here.
It's on page 80.
Well, page numbers are different.
Okay. Be line up 11-15-8-31.
201-31.
Two from the bottom. One
Correct. You had 19,000, you had $2,800.
That was a grant.
Yeah.
Was that-
Was that, wasn't that not a grant?
I'm trying to tie back to the revenues, see if I can find.
If you look on the revenue side, I believe you'll find where that was a grant for, I can't remember the name of it.
When it says outreach to, this is to notify people of your services, that.
Well,
Oh, that, part of that 211 system,
Yeah.
that 211 is, I'm not sure if that's what it is or not, but as you recall, when they came and made a presentation to the board about the 211, where it calls, checks on people and so forth, is a resource telephone number. We had one that Mr. Bill and the previous board put together, and maybe a couple of years too, when we said the helpline. Remember that?
Yes.
So this is basically another helpline that got sponsored through United Way and Duke Power and so forth. And basically they came and asked the board to consider contributing to
It's
that.
a one-shot deal.
Well, no, it's a continuing thing. They go funded for 3 years and then it turns over to the county. But
And then we'll see
I
if
think
we
the board
need-
asked them, so are all the other 7 counties in our district participating? Find out and let us know. They are participating, but they didn't let us know until the bill came due. And so y'all went ahead and did an amendment this year's budget to include that cost in this.
These are CRC funds, and I apologize, but I'm not sure what CRC stands for, but this is one where the revenue went away, the expenditure went away.
Yeah.
I mean, it's obvious that happened, I was just curious what
Yeah,
that.
but on the revenue
what
side,
that
I found
outreach
it.
means.
But if you really look at if you really look on that same page, Mr. Chairman, you'll see where that's part of it, that's a big reduction, but the adult daycare,
That's really the only difference.
well, he's servicing more people now than ever.
Let me tell you what
with
it
the
is.
new building.
I'm gonna toot their horn just for a second. For the first time in I don't know how long, we have buses coming across the mountain from Nanahaler with people in them to participate in the activities at the senior service center. I've been trying to do that ever since I got here. That is actually happening now, and that's happening pure and simple because of the efforts of the people that were
And
funded.
those folks been able to hold on the number of employees and what they do. You go out there and stay half a day. I'd encourage anybody on the board to go spend a half a day. Just spend a half a day there, or one day. And,
Has everybody gone and just taken a tour of everything? I know you have. That's just, I did too. That's just a great.
so.
And what an obligation we have, I mean, part of my thing in this rec park is we have, to me, a huge obligation to take care of old people and kids.
They're not penalized because of their age or work.
The county renovated that building. The old one was been used, it was just an old vacant building that's been used for the library. The county, actually, most of the work is done by our own county employees.
So when was the library, when did the library open?
The library, the new one, 2006.
Six, and then this building opened in '9.
We opened in 2008 or 2009.
So it sat there, it sat there empty for 3 years.
Yeah, and they talked about selling it at one time, but the county spent $300,000. The county spent $300,000. Mr. Chairman, the county spent $300,000 and renovated that building. We took $100,000, but that was for the sprinkler system that had to go in, and renovated that building. I think we have probably one of the best senior services building in the region right now. And I'm sure y'all got thank yous from the Crawfords after the dedication. But the people over there, what they were. I have to say this because I was here when we put the original one up over next to Walmart. We got a grant to put that metal building up. The county employees did most of that work back then too. And we've had that from 1986 or 7, something like that, until this past year, or this past 2009, when they moved into that one. And it's a whole bit more, it really is, people really enjoy it. And the thing about it that makes it so good is you've got a dedicated staff that really loves working with those folks.
Oh, yeah,
They do. And that makes it work.
You really got a heart, though.
Yeah.
Anything else, gentlemen?
Program.
That's all part of that.
Yeah.
I didn't see anything else in that. The recreation's the next one. I just got a comment. The recreation budget's pretty flat. You're talking about the renovations we're talking about doing, if you compare our neighboring Jackson County, their recreation budget's almost double.
Well, you got one right before that, Mr. Chairman, you may have the library.
Oh, I'm sorry.
Oh, yeah.
I thought that, yeah.
Yes.
And that's another one of the appropriations to, Montana Regional Library System that operates our libraries here in the county.
And your recommendation was flat with
It's
it.
all outside agencies unless there's any circumstances or at current year levels without an increase.
And I can tell you that increase was, do you mind if I tell you what that increase was? That increase was a salary increase, which just didn't, I mean, that's a lot. We're in the position to be able to do that. They did not get a salary increase when the county employees did because they're not county employees. They work for Montana Regional Library. But that's where that money is, if you want to know what that difference is. And, well, with my library, I wish we could have gotten it. I understood it fully, and I tried to explain it in that problem time. And the board said, well, we're going to ask for it anyway. Okay.
And that's fine, another measure of the game.
That's exactly right.
We're trying to be even with all of the county funds out there.
Of course, Mr. Cummings, looking on down to education, after believing Raleigh, y'all know as well as me, that we don't have a clue. $500 million they proposed to cut public education. I don't know what kind of impact that'll have on us if that holds. Of course, I do think there'll be a lot of discussions. I think that's the word that.
There's a lot of discussion last night on the budget.
Yeah,
At 11 o'clock last night.
There's a lot of discussions today too.
I want to tell you just my opinion as an educator and sitting in that room that we sat in. If we're looking for the Senate to save us, I'm not sure they're going to. So I would stand by for some real problem. It's just my opinion,
The
but
only glimmer of hope is that they'll reduce the amount of reversions.
that may be the only thing.
And there's some
Well,
sentiment of
and I don't think there's
Republicans
I don't think
to do
there's a
that.
vote there to override the governor's veto. I really don't think there's a vote there now, the way it looks. That's our only hope it looks like.
You got some Republicans
I hope, but they sort of clean it.
That's what I'm saying. If you leave it up to the president pro tem, you're in trouble.
It's over.
You're in trouble.
It's over.
Jimmy, anything else on those last 2 or 3 pages? I
Still a little more good news, more good news on the education that was asked so long ago. He's actually not going to break the lines.
Any reason? Maybe.
It said something about municipalities not being cooperative or something.
Say it again?
The text said, QZAP didn't come through because the municipality wasn't cooperative or something.
municipality, like the town of Holland?
I'll have to get more info.
Okay.
Isn't the town who partnered with them?
Jim got a text that the QZAB money for Highland did not come through. And the reason given was that the municipalities were
I
not.
was uncooperative or
Was uncooperative.
something. I'll have to call you more in fact.
That doesn't make any sense. It doesn't have anything to do with the municipality.
We would certainly correct.
Unless, this is what it may be. Let me give you what it probably may be. In order to draw down the QZAP, you got a local sponsor. And so I think the school is going to ask the town to be the local sponsor.
It was.
And because of the money that's generated and the town supports the scholarship fund for the students up there, they're going to use that program as an indication of local support for it. Maybe there was some problem with that, but that was what they were going to try to use. It must be that the town, for some reason, didn't qualify or wouldn't participate as a local sponsor. So that's the only thing. There's plenty of money in the QZAP budget to do that if you get a local sponsor. So it sounds to me like there's a problem with the local sponsor.
The last update that Dr. Bergman gave was, the last school board meeting was that Brian with the town of Highlands, Brian, whatever his last name is, worked with the town of Highlands to get it approved, and they agreed to partner with it, and that was success. Maybe the people who accused of, maybe the state wouldn't accept the municipality as the 10%.
That may be.
max.
That may be.
From the outside,
We'll need to
Jim,
find
Might
out.
have to be a
We'll be
local
low down.
business.
We can help, we can.
Yeah.
Might not be.
It's not too late
might
to be
not-
local.
Municipality might not
Yeah.
qualify.
We had a local support even in the Annahaven community with folks up there on that $1.8 million QZAP.
How much money was it? Yeah, I know it was under $2 million.
John, anything on we got Highlands Recreation, it's the same, and of course, education, and maybe reference. And I would point out, and just as talking about the recreation thing, go back to that, CES budget is just a smidge more than Highlands and services a lot. And of course, we understand why. Yeah. Absolutely. Anything else, gentlemen? Special appropriations. Let me see what all those are. Is it fair to say that's sort of a catch-all, Jack?
Special appropriations.
Yeah.
That 50,000, that first line item, that's your community funded pool money. So, I know I'm new here, but from what I gather, that 50's put in there, and then there's applications received, and then that 50's distributed to whomever.
And I already.
So that's the 50,000 that you guys have allocated every year for the community funded pool.
And there's so many needs, you know, you wanna see, as a kid's place, they're really worried about their budget.
Well, was Kids Place, I think the figure was 16,000 that they got from the legislature, and that has been approved. I checked on that while we're down there.
But it's still, even, they're just over, it's sad to say, but the kid budget is just overspent. And that's not a good thing.
So which, given the three, I'm sorry, I'm doing this, I'll have to explain who the three we are.
The 50,000.
50,000 is the community fund.
Look at
The
special
15
appropriations.
is State of Franklin.
State of Franklin is a senior age program for senior adults. It works. We have, if you're over, actually, if you're over 55, low income, you can go on a training program through our senior age program, which covers all the western counties. And we pay $15,000, and we get about 15 more senior aides, and they help us in housing, soil conservation services, libraries, senior aid. What for senior aides, the senior services program can operate.
True.
Jim, back that 50,000, you what was the community funding pool is? Okay.
That's a presentation.
Yeah, and Bobby and I are the liaisons to that, and I think that was started, Jack, 10 or 12 years ago, so instead of all these groups coming to the commission.
Yeah, it was a way to, instead of having 50 different people asking the board for different bits and pieces of money,
Yeah.
we set up a community funding pool, and so they go through an application process, they prioritize them, they know that the limit they've got is $50,000, and they prioritize that, and not everybody gets money every year.
They do a great job.
When Bobby and I sat down with them last year, we were the players, I guess we are, not put us back. But, yeah, they do a great job of dividing up that 50.
It'd sure be nice if you could have more, but we recognize.
You know, just for instance, Macon County Reach, of course, Jackson County is gonna supplement them somewhat, but, after serving on that board for many years, they too are just, it's just slam. I mean, and that's not a good thing.
I'm somewhere.
Well,
20,000 is the
Historical Society.
Is that Macon?
Macon.
Yeah, Macon County Historical Society, that program started from assisting them. They, that museum right across the street, the Macon County Historical Museum, and Macon County in years past had done anything except let them use Macon County to describe it. So, maintaining their building, improving their building, and keeping their doors open to what the history of Macon County is, what that's for.
Gentlemen, that completes our general fund expenditures. Unless anybody has anything we need to go back through, I'll just point out the big picture again, the 2012 revised budget, which is the budget we're currently under, is $45,788,503, if I'm reading the right number. The proposed budget is $44,275,869, which is how much less is that?
3.3%.
About 3.3% less than last year's budget. So I think one reason our budget process is so smooth, we started out in January, and you guys did an awesome job of communicating Jack sort of our goals and priorities,
And Lord, we know that this is your first real budget year, but we can't say enough about the work you've done on this stuff. And I think the county manager would agree. I mean, we were all very, I to be honest with you, you were all very anxious. Evelyn said, I've been here forever, and, you know, you get used to working, but.
Well, she tried to retire 6 months early, we talked her out of it.
But
That's
Ron,
good
we
point.
can't thank you enough for the job you do. We hope you're happy.
And if Jack Orton plans on resigning anytime in the next 4 years, I mean, he's a wonderful county manager. This is a great job on the budget to come out 3% less.
So
than
where do
last year.
we, from here,
We have a public hearing scheduled
public
for
hearing.
6 P.M.
Now, we do have a list, how are we gonna tackle the list? We do have a pretty good list of things that,
We'll just go through at the beginning of the public hearing, just make a notation of the things that the board's considering as far as adjustments to the proposed budget. We'll state
I think you
that
have to verbalize those to
at the beginning of that public hearing, and then basically the public hearing is take input from folks who want to tell you what to add or cut in the budget based on their opinion, and take that into consideration. And we haven't really scheduled a final vote on the budget until your regular meeting, which is a week from next Tuesday. And then unless
When's
there's
the
some
hearing?
change.
I missed that.
Next Tuesday.
Fifth.
Next,
It's coming
the
Tuesday.
fifth, I'm sorry.
it's next Tuesday.
It's coming Tuesday.
Coming Tuesday.
At what time?
16.
That's it.
I don't know what the other.
And that's all we're doing is
That's
that.
it, that's all we're scheduled for that.
They already have
Public
minutes.
hearing on the
So that
budget.
shouldn't take too long, unless we have.
Well, it depends on how many.
Depends on how many.
have public
Oh, you
hearings.
just have it.
We'll speak, so.
You might have, and one other question, Jack, when do you need a decision from us on these fire budgets? When do you need that, and do you need
Well, I
that?
would think that we would want to mention what the list that's out there. We're going to have to get together one more time between the public
Because-
hearing and to discuss, what we heard at the public
Because
hearing.
what you need to do is the public needs to be able to comment on fire budgets too.
Well, I think that they know what's proposed.
So do we just show them what?
No, basically, well, I think Commissioner Covers is right. He was saying basically what you, the reason for a public hearing is to get input.
Get input.
Take that input and see if you want to take that input and make any adjustments to what's been proposed. And one of the things that you probably want to spend some more time on is talking about the request for the tax increases for the fire department.
And I think you may get some public input on that.
Well, that's what,
You might-
so.
you might-
So I don't think we
So
should
you don't
vote on
want-
that
you don't
until we
want
get to
input now
public
from
input.
us.
No, we want input from the public now, and then after the input from the public, then y'all need to.
If we
reconvene.
still intend to vote the budget on the 11th,
Then you need
That's right,
sometime
12.
before
then we
that.
need
I
to meet
guess-
sometime between.
The reason for my question, protocol, because this you have a proposed budget. You've got to propose hard numbers.
Right.
The fire budget, you've had them just come say,
Yeah, we
"Go
got,
out
Yes,
there."
you got it.
proposed budgets too.
Oh, I know that. I
There's
know
the
that.
proposed budget,
I agree.
and it's no different than anything in here. It's proposed. We just had them come in and
Okay.
explain.
I guess the difference is there's an implied, we've implied that we agree with this, with the regular budget.
I don't think we have, because we've got a list of things that we don't know what we're gonna do with yet. So I don't think we've applied anything.
The
I
budget's
think
gonna
we've
change.
said, I think what
Yeah, I
we've
think
said
we
is,
have to
here's
do
the
that.
budget, here's what we're thinking about, here's the fire budget. Have you got any comments for us
And then
on this stuff?
we make changes.
Then we
Okay.
assess those comments, and then we have another meeting, we make the changes, we finalize.
I'm just trying to decide in my mind, do we decide on the fire budget before then?
Yeah,
I don't
what you
think so.
basically do, you don't go through the firefighter budget, you basically approve whatever the tax rate is for the fire
Right,
district.
exactly.
That's
Right.
basically what you have to decide,
That's right.
whether that's justified or not justified, and then,
But they
And I think based on my constituency, I would prefer we did not vote on the fire budget until after public
Oh, no, you
input.
don't.
Because I anticipate that we will get significant public input.
I agree.
And I'd like to hear that before I
Well,
cast
is
my
this,
vote.
is this new? Is this just laying here?
That month probably has been laid.
That was
there.
last
That was
time.
old.
Because I think that,
Go ahead, Ron.
I think that taking public input, we need to really listen to what the people, communities is thinking about this.
Absolutely.
If you have an opportunity, please read change letter that's in your box. You find it very interesting.
And let me close with one other thing, and I told Colin why I meant to start with this, because it's important. I think we need to give a little report about our trip to Raleigh. And I'll just give some general comments and let each one of you guys, talk, but we did make a trip to the legislature to Raleigh, and that was all day yesterday. We started out about 9 o'clock with a general meeting with all the commissioners. There were roughly 300 commissioners there, which equated to about 3 per county. We had 4. Would have had 5. Mr. Tate had some personal issues that he had to take care of, wasn't able to attend. We'll leave it at that. But 4 of the 5 of us did attend, so we had excellent attendance from our county. We had the opportunity between Tuesday night when we got there, and Mr. Mills there a little earlier Tuesday, and then all day yesterday, we had the opportunity to meet with Senator Davis. Personally, we met with Representative West. We got a personal audience with the Speaker of the House, which was, we were one of the few groups that did that. And I'd like to thank Representative West for helping us line that up, but we had actually spent about 20 minutes with the Speaker Tillis, and I think we're pretty effective. We probably influenced, or thought we influenced, at least 3 pieces of legislation, it was just nice to have that relationship. And then, of course, during the morning session, Commissioner Bill was very active in that, and we're very proud of his involvement in our state organization. He moderated the panel. Ron, I guess you call that economic or political trends.
Well, they had 2 of the top political consultants,
advisors
in the state, and one on each side of the one on Democrat, one Republican, give their perspective. Because what concerns the county more than anything is, regardless of the election outcome, regardless of who goes in, there's going to be at least 50 new faces in the legislature. 50 new faces.
Maybe 60.
Maybe 60. And it's,
Would they say couple that with the 40 that they got last time?
Yeah.
That means in 2 election cycles, you turned over 90 out of 170 people.
so the point is, you have to re-educate these. Like when we go, I went Tuesday, and we started at 8 o'clock Tuesday morning. And we saw some different folks than what, at the executive committee, we went and saw the leaders of the minority, Speaker Hackney, Senator Nesbitt, and we also met with Senator Berger, who done the education budget and a lot of these things. Of course, we met with Jim Davis and Mr. West and some other folks. And what you find out that there's so much stuff going on down there that they don't really want, like the Senate Bill 433 that we thought was still in the water. Well, it got pulled from committee today. We don't understand that. The LME governance thing that we've worked hard on, there's some changes to it that is going to be brought back up next week in committee. So, there's a lot of things going on down there, and this budget is going to get a tremendous amount of talk. Even, like Kevin said, even the majority party, a lot of them don't agree with. But we did get school lunches fixed today. Yeah, the Senate voted that in. So,
one good thing
about
about
that,
I'd like to say
they checked the bag lunches.
Oh, yeah. Yeah. The legislators do listen to county commissioners. I think they understand that we're the guys with our feet on the ground. That's a good way to say it, Jack. We come in contact with our constituency every day, in the grocery store, church, and
They can find us.
they find us. We're accessible, so we hear these things, and I'll have to say I'm proud of our group. We're not afraid to stand up and speak and take it.
And as far as the sweepstakes issue,
Yes.
the sweepstakes issue, the questions we had, I think they're basically waiting on a lawsuit or a court order that's in the court now and going through the court system. The legislature's basically not going to do anything.
Until that's resolved.
But I did talk to a senator from Alabama. Alabama, he owns property here. Alabama had this same problem. They tackled it, and they got it. There's nothing in Alabama.
But no, we did, I know that's a big issue. We talked to,
Al moved here.
we talked about all our representatives one way or another about the sweepstakes, and I think there is an interest in either coming up with legislation or regulation, but I think they won't go about it.
Definitely this court case, something's done before they'll even touch it.
But we took the message from our people to them, and our people need to know that. I thought it was very productive. We had a good trip, and very
I think the important thing that they understand about the Clear County Commissioners Association is you have problems with the budget on the state level. Don't try to solve your state budget problem by putting extra burdens on the county.
Well,
they understand that.
Exactly.
And they're trying to stick to that, but it may not be 100%.
And some things that really that concern everybody is, of course, there is a provision now to cap the gas tax. And we've always said that's the first indication. We cap the gas tax. If you look at the state budget, the DOT budget going out in the future, it's gone anyway. They have to cap the gas tax, or less and less gas is being used. And if they cap the gas tax, which it looks like that's proposable, that's always been the first indicator, you know, of the county being looked at. So that's always been our first, that's on the agenda.
That's been brought up.
Commissioner Haver, do you have anything to add?
No, we
You
was
enjoyed
talking
Raleigh?
about- We was talking about that right there. We kind of figured in a couple of years they try to dump it on us.
But that, they
But
did
your,
make.
but your association's out in front of that one. at
Well,
least.
it is.
And they're all over it. And I guess the only thing I'd say is that sometimes people say, gosh, why don't Florida need to go down there? You ought to experience it. And I wish you could have come, because you would have, they walk up to you, walk up to a crowd of commissioners. They may not know your name, but they'll look at you and they'll go, this is my fourth one of these now, Macon County. I know you guys. And you
And
walk
no
in,
matter what party.
you walk in, I walked into Speaker Tillis's office. Now, I might have been introduced to Speaker Tillis for about 30 seconds one time. What's the first thing he said? I know you. I met you. Macon County.
Yeah.
And I said, yeah, that's right. And so you can't put a dollar figure on it. Yeah, I can't tell you how much eventually it's going to save or it's not. But I know that when we went eyeball to eyeball with the speaker over 433, there was no doubt in his mind where we stood on 433.
And he agreed.
And he agreed with us,
With you, Bob.
which has set up a really fun debate. I'd love to be fly on the wall.
But the
Down
ranker
right
level
now.
has never been at this level.
No, it's
Anybody that's
unbelievable.
ever, Joe Hackett has been there for 20-something years, it's never been at this level.
But
Ever.
to finish up,
Right.
you got to understand that we are also very fortunate to have, Commissioner Corbin, who actually engineered the meeting with the speaker. We would never have gotten there otherwise, and I appreciate that. And it's so great to have Mr. Bill. We all get the letters from the association, so we know what the big picture is. But if you want to know the words to say or the people to talk to, this is the guy that knows that, because we've got to go on the inside of the association. So from my perspective, it really has. The last couple we've gone down to have really been useful, and I appreciate the effort.
Just to say what you're not saying, we've got leadership here on this board from both political parties, that we've got some influence with some people in Raleigh, and that's good to have. That's positive. Anything else to add?
You got a closed session, Mr. Tucker?
5 minutes. I swear, guys, 5 minutes.
So, we're going to closed session, we have a second. 5 minutes.
There won't be anything coming
All
out
in
of
favor?
it. It's just
Andy,
information.
did you have anything?
Oh,
We
it's
just
for the
discussed
purpose
later.
of
Discussing land acquisition.
possible land acquisition.
But I will tell you, we will take no action tonight.
Yeah, there'll be nothing.
And I'll tell you what, I won't have them talk about no Cavaliers back there.
Oh, we will.
They Brett Whitney.